Members of council, if you can please take your seats. This meeting is now resumed. Before the recess, council was considering item EX 30.33 on the cost of preventing information being released at Toronto Hydro. We will return to that item later in the meeting. Before we consider members' motions, I would take the release of member holds. Are there any quick releases at this time? Councillor Fillion.
Page 5, North York 27.4, I'll release that. Request for direction, zoning bylaw amendment application 286 Finch Avenue West, Ward 23.
Okay, on page 5, NY 27.4, Councillor Fillion would like to release. On favor, recorded.
Councillor Perks.
Councillor Campbell, please.
The item is adopted unanimously, 31 in favor.
Councillor Karygiannis.
Thank you, Madam Chair. On page 4, GM 24.4, future options for the city-operated golf courses. I'm releasing it, and I know that Councillor Fletcher wants to hold it. She's got a motion she wants to put on, so I'm releasing it to her.
Okay. So we're going to continue holding that?
Bigger question marks.
Okay.
So that will be it, Councillor Fletcher, that will hold? Okay.
Okay, Councillor Fletcher to hold. All right. Councillor Fragadakis.
Yes, Madam Speaker. Sorry, could I? It's on page 6, CC 36.2, establishment of a nominating panel for appointments to the Compliance Audit Committee. I have a motion. Staff have it. Councillors Jim Hart, Councillor Paula Fletcher, and Councillor Lucy Troisi have agreed graciously to give of their time to nominate people to the Compliance Audit Committee.
Okay, so that's on page 6, CC 36.2. On favor, recorded vote.
Notice how we tricked the newbies into going on this committee?
Deputy Mayor Minnan-Wong, please. Councillor Layton.
The motion carries unanimously, 34 in favor.
Councillor Cressy.
Thank you, Speaker. On page 6, item CC 36.4, development charges bylaw, OMB appeal related to 245 to 255 College Street. I can release that now.
Recorded.
On page 6, CC 36.4, Councillor Cressy is releasing. Recorded vote.
Councillor Kelly, please. Councillor Karygiannis, Councillor Layton, Councillor Pasternak, Councillor Wong-Tam, please.
Councillor Bearmaker, please. Councillor Fillion, please.
Councillor Fillion, please.
The item is adopted unanimously, 34 in favor.
Councillor Crawford.
CC 36.9, this is on behalf of Councillor Robinson, who asked me to move this. This 169, the Donway West, request for directions regarding an Ontario Municipal Board Appeal Ward 25. She just wants it deferred, I believe, till the March 26th meeting. So it's on behalf of Councillor Robinson.
Okay, so on page 6, CC 36.9, items being deferred.
Then I will continue the whole. I'm holding on behalf of Councillor Robinson. If we can just chat then.
All right. Councillor Fletcher.
Yes, I'm going to try again on the golf courses with a quick release with the motion that Councillor Holyday is good with. Ms. Romoff has written. And Councillor de Beermaker also has a quick one adding the TRCA on, although I'm not sure how quick it is. So I think if we could just do those both, we could dispense with that item, Speaker.
Okay, so we're going to go back to page 4, GM 24.4, future operations for city-operated golf courses. So Councillor Fletcher has an amendment on the screen.
Why?
Is everyone okay with the amendment? Okay, let's put all the motions. Councillor de Beermaker, do you want to put yours up? Okay, Councillor de Beermaker.
Just requesting input from the TRCA.
Tree canopy.
More trees is more hazard.
That's harder to play.
Okay, Councillor Holyday?
All right.
It's not quick?
No, that's gone. No, I'm not placing that.
Okay, this is not a quick item according to Councillor...
He's withdrawn it.
Councillor Perks. Councillor Perks has issues with it. Okay. All right, okay. We're not releasing the item.
Sorry, why is that gone up there if the councillor isn't placing that item? I understand Councillor Holyday is not placing that item.
There was confusion here because of the way this is unfolding at the moment.
No, but Councillor Perks, is it the Councillor de Beermaker's motion that you have an issue with? Okay, Councillor Holyday.
On a point of privilege, I had contemplating placing a motion and had prepared it with the clerks, and I have opted not to do so.
Oh, okay. All right.
So we're back to the Fletcher.
We're back to the Fletcher and de Beermaker. All right. So is everyone okay with those two? All right. So let's put Councillor Fletcher's motion on the screen, and we'll vote on it. Recorded vote. Recorded vote.
Councillor Holland, please.
The motion carries 36-1.
Okay, we have Councillor de Beermaker's. Okay. Yeah, we're gonna correct that. Okay, Councillor de Beermaker's motion.
The vote on Councillor Fletcher's motion is 37-1.
Councillor De Bearmaker's motion. All in favor? Recorded.
Councillor Kelly, please. Councillor Wong Tam, please.
Councillor Campbell, please. Councillor Giciano, please.
Councillor Wong Tam.
Councillor Crawford, please.
The motion carries 36 to 2.
Item is amended. Recorded vote.
Councillor Wong Tam, Councillor Layton, please. Councillor Perks, Councillor or Deputy Mayor Min Wong, please.
Councillor Mihevc, please. And Councillor Crisanti, please.
The item is amended, carries 36 to 2.
All right. Now, we do have a couple of motions to introduce. Councillor Troisi.
Which one? Can I do? Which one is this?
Okay. Yep. Thanks, Madam Speaker. Authorized to release Section 37 funds to real estate services for installation of public art at Union Station.
Okay. On favor? Carried. Councillor Troisi, you have another one?
Yep. Liquor license application. This motion is urgent as the deadline for comment is January 31st, 2018.
That was yesterday.
That's what they gave me today. Sorry, it's probably 2000. I don't know. I'll have to check with clerks. Okay.
Well, the deadline was yesterday.
Let's just do it and see.
On favor? Carried. Just a Councillor Fletcher.
6 votes, Steve.
I have a motion to introduce on the Smart Track station for Gerard and Carla. I'm looking for planning, station planning work and a neighborhood planning study.
Recorded.
Who said that? You?
On favor? Recorded. To introduce it?
Yeah.
He's here now.
Not messing around.
I heard that he's not coming back.
Councillor Karygiannis, please. Councillor Davis.
Councillor Crisanti, please. Councillor Giciano, please.
The motion to introduce carries unanimously, 39 in favor.
Councillor de Bearmaker.
Thank you, Madam Chair. I'm moving a notice without motion regarding a resolution supporting the efforts of King Township, York Region, and the Toronto Region Conservation Authority in their efforts to protect the headwaters of the East Humber River. And it's urgent because the decision regarding the establishment of the East Humber Headwaters Park will be decided or discussed by the Ontario government in March as part of its provincial budget deliberations.
This is urgent.
All in favor? Carried. That's it? Okay, members, we'll go through the members' motion now. MM 36.2 has been withdrawn. MM 36.3. Okay, there's a revised member's motion on 36.3. Notice if this motion has been given. This motion is subject to referral to the Executive Committee. A 2/3 vote is required to waive referral. All in favor? Recorded. All right, so do you want a recorded vote? Okay, recorded vote.
Councillor Bailao, please, and thank you. Councillor McMahon, please.
Councillor Crisanti, please.
The motion to waive referral does not carry. The vote is 16 to 23.
MM 36.4. Notice if this motion has been given. This motion is subject to referral to the Executive Committee. A 2/3 vote is required to waive referral. All in favor? Carried. On the item, all in favor? Carried. MM 36.5. Notice if this motion has been given. This motion is subject to referral to the Executive Committee. A 2/3 vote is required to waive referral. Recorded vote.
Councillor Perruzza, please. Councillor Karygiannis.
Councillor Crisanti, please.
Councillor Karygiannis, please, your vote.
The motion to waive referral carries 36 to 4.
Hold. MM 36.6. Notice if this motion has been given. This motion is subject to referral to the North York Community Council. A 2/3 vote is required to waive referral. All in favor of waiving referral? Carried. On the item, all in favor? Carried. MM 36.7. Notice if this motion has been given. This motion is subject to referral to the Etobicoke York Community Council. A 2/3 vote is required to waive referral. This motion relates to a Toronto local appeal body hearing and has been deemed urgent. All in favor of waiving referral? Carried. On the item, all in favor? Carried. MM 36.8. Notice if this motion has been given. This motion is subject to referral to the Executive Committee. A 2/3 vote is required to waive referral. All in favor of waiving referral? Carried. On the item, all in favor? Carried. MM 36.9. Notice if this motion has been given. This motion is subject to referral to the Toronto and East York Community Council. A 2/3 vote is required to waive referral. All in favor of waiving referral? Carried. On the item, all in favor? Carried. MM 36.10. Notice if this motion has been given. This motion is subject to referral to the Executive Committee. A 2/3 vote is required to waive referral. All in favor of waiving referral? Carried. On the item, all in favor? Carried. MM 3611. Notice if this motion has been given. This motion is subject to referral to the Etobicoke York Community Council. A 2/3 vote is required to waive referral. All in favor of waiving referral? How come nobody's putting their hands up? Opposed, if any? Carried. Pardon? Oh, on the item, all in favor? Carried. MM 3612. Notice if this motion has been given. This motion is subject to referral to the Scarborough Community Council. A 2/3 vote is required to waive referral. All in favor of waiving referral? Carried. On the item, all in favor? Carried. MM 3613. Notice if this motion has been given. This motion is subject to referral to the Parks and Environment Committee. A 2/3 vote is required to waive referral. All in favor of waiving referral? Carried. On the item, all in favor? Carried. MM 36.14. Notice if this motion has been given. This motion is subject to referral to the Civic Appointments Committee. A 2/3 vote is required to waive referral. All in favor of waiving referral? Carried. On the item, all in favor? Okay.
Motion moved by the two Wongs on this council. Doesn't happen very often. Pigs aren't
It
flying
never
outside.
happens.
And I'm happy to work with Councillor Wong Tam whenever she'd like to.
Policy wands. Policy wands.
On the item, all in favor?
Sorry you did it, eh, Kristen?
Well, I think that Councillor Wong Tam deserves a hug.
Policy wands.
What did he say?
Two wands don't make a right.
All in favor of the item? Carried.
No, if it's too long,
Make a left.
MM 36.15. Notice if this motion has been given. This motion is subject to referral to the Toronto and East York Community Council. A 2/3 vote is required to waive referral. All in favor of waiving referral? Carried. On the item, all in favor? Carried. MM 3616. This motion has been deemed urgent by the chair. This motion is not subject to a vote to waive referral. This motion has been added to the agendas before council for debate. On the item, all in favor? Carried. MM 3617. This motion has been deemed urgent by the chair. This motion is not subject to a vote to waive referral. This motion has been added to the agenda and is before council for debate. On the item, all in favor? Carried. MM 3618. This motion has been deemed urgent by the chair. This motion is not subject to a vote to waive referral. This motion has been added to the agenda before council for debate. On the item, on favor? Carried. MM 36.19. This motion has been deemed urgent by the chair. This motion is not subject to a vote to waive referral. This motion has been added to the agenda before council for debate. On the item, all in favor? Recorded vote.
Councillor Kelly, please, and thank you. Councillor Perks. Councillor Wong Tam, please. Councillor Perruzza. And Councillor Thompson.
Councillor Mihevc and Councillor Holland, please. Councillor Holland, please. Councillor Holland, please. Thank you.
The motion carries unanimously, 41 in favor.
MM 36.20. This motion has been deemed urgent by the chair. This motion is not subject to a vote to waive referral. This motion has been added to the agenda and is before council for debate. On the item, all in favor? Carried. MM 36.21. This motion has been deemed urgent by the chair. This motion is not subject to a vote to waive referral. This motion has been added to the agenda before council for debate. On the item, all in favor? Carried. MM 36.22. This motion has been deemed urgent by the chair. This motion is not subject to a vote to waive referral. This motion has been added to the agendas before council for debate. On the item, all in favor? Carried. MM 3623. This motion has been deemed urgent by the chair. This motion is not subject to a vote to waive referral. This motion has been added to the agendas before council for debate. Did somebody say hold? Oh, okay. MM 3624. This motion has been deemed urgent by the chair. This motion is not subject to a vote to waive referral. This motion has been added to the agendas before council for debate. All in favor? Who's that? Councillor Shiner? I can't hear you. Are you holding it or not holding it?
No, I'm ahead of myself.
He's fine.
Thank you.
Pardon? We should be at 3624.
Oh, then I do want to hold it.
So you want to hold this?
You had 23 up on the screen. 24? Yeah, I want to hold that. I asked first.
Well, I'm sorry, Councillor Shiner, it said hold.
He jumped the gun. I want them back at the starting line and try it again.
MM 36.25. This motion has been deemed urgent by the chair. This motion is not subject to a vote to waive referral. This motion has been added to the agenda and is before council for debate. On the item, all in favor? Carried. MM 3626. This motion has been deemed urgent by the chair. This motion is not subject to a vote to waive referral. This motion has been added to the agenda and is before council for debate. All in favor of the item? Carried. MM 36.27. This motion has been deemed urgent by the chair. This motion is not subject to a vote to waive referral. This motion has been added to the agenda and is before council for debate. On the item, all in favor? Carried. MM 36.28. This motion has been deemed urgent by the chair. This motion is not subject to a vote to waive referral. This motion has been added to the agenda before council for debate. On the item, recorded vote.
Councillor Karygiannis, please. Councillor Lee, councillors.
Members, can you please sit down when we're voting? Councillor Thompson, Councillor Bailao, please.
Councillor Fletcher, please.
Councillor Perruzza, please.
The motion carries unanimously, 41 in favor.
Okay, so that's it for the members' motions. Now we do have So which one is first? Okay, so we have a timed item, which is on page 6, CC 36.12, which is the Ombudsman report on Toronto Community Housing. Oh, yes, I'm sorry. Before you start, Councillor Crisanti has an important announcement to make.
Important announcement. You know, when I get up, it's got to be important. So I want to introduce to you a very fine young man, and the future, I'm sure the future politician, maybe Prime Minister, certainly Toronto City Councillor. Our good colleague, Councillor Mark Grimes, recently became a grandfather. And the baby's name is, go ahead, give him a big hand. The baby's name is Jonathan Dennis Grimes. They call him JD. He was born on January 10th at 9:34 a.m. There he is. Weighed in at 4 pounds, 8 ounces.
Yay.
And he was born to Mark's son, Jonathan, and his wife, Shannon. And Mark is now known as Babalu. Congratulations, Babalu. Thank you.
So sweet. I guess that explains why Councillor Grimes is not wearing his ties these days, eh? He's a grandfather now. Okay, so we've got the Ombudsman.
Madam Speaker, should I proceed?
Yes.
All right, thank you. I just have a short presentation, and then, of course, I would be happy to entertain questions from councillors. This investigation arose because of two complaints that my office received. They are briefly set out here. One was from a young mother, a TCHC tenant, who complained after her application for a medical or safety at risk priority transfer was denied. In her case, it was a transfer she was requesting for her safety. She had witnessed a crime outside her home, a violent crime, and she was no longer living in her unit. She and her child were living in a shelter. After her application was denied, and when she was not in her unit, somebody broke into her unit and left a gun, a loaded gun, in her child's drawer. So she applied once again for a safety priority transfer status, and again her application was denied. And when we looked at the reasons, we found that they were vague and they contradicted TCHC's policy. The second complaint that we received came from a family who also had had an application for a safety transfer denied. Someone had fired 2 shots into their living room through the window from a car outside, and then 2 of their children had been assaulted on the way home from school. And in denying the application for the safety priority, TCHC cited the absence of a police report, although the family had tried to get one and had been unable to do so. So with our help, they resubmitted the application, and then unfortunately their file was lost for 4 months by TCHC. So as a result of these 2 complaints and our looking into them, we the Ombudsman's Office became concerned about how this process actually works, this process for tenants who are concerned about their unit causing or aggravating either a medical or a safety concern. How does this process work for priority applications, decisions, and transfers? So we launched an investigation. And during our investigation, we looked at the fairness of the process from in every respect, from the very beginning, where tenants are putting together their application, to the very end, where the approved households are put on a waiting list. So we looked at how the applications are prepared, how the decisions are made, how those decisions are communicated to tenants, and how the waiting list is administered. In doing the investigation, we reviewed 606 applications and decisions. We spoke with more than 30 witnesses, including both TCHC staff and also TCHC tenants. We also spoke with leaders and other staff from 2 city divisions who have a significant role in the oversight, if I can call it that, of TCHC, and those are SSHA and SDFA. So we got their input as well into some of the issues that we were looking at about this process. And of course, we reviewed the relevant legislation, policies, and procedures. The significant findings that we made were these. In terms of the applications and the decision making, we found that there was both procedural and substantive unfairness. In terms of unfair procedures, tenants received vastly different amounts of help and support from TCHC staff when putting together these applications for something that is obviously very important to them. And as well, we found that the requirements for the application packages are really unclear and are unevenly applied. In terms of the unfairness in the substance of the decision making, we found that the decisions are inconsistent and often contradictory. The criteria that should be applied seem to be applied sometimes and not at other times, and are not applied consistently but rather somewhat arbitrarily. And finally, the reasons for decision, to which tenants, of course, are entitled, we found are more often than not inadequate, if not altogether absent. We also made significant findings with respect to the waiting list, and this pertains, of course, to households that have their applications approved. So they get the priority, they go onto a waiting list for medical or safety priority transfer. And we found that in 3 ways, this waiting list and the way that it is operated is unfair to tenants. The first problem is that the waiting list makes no distinction among the households on that list based on how serious the circumstances are. So once a household's application is approved, it goes on a waiting list chronologically, and whether its circumstances are dire or not dire is not taken into account. The second fairness problem we found with the way the waiting list is administered is that in some cases, and particularly this I think occurs when a household has an advocate helping them, TCHC senior management approved discretionary transfers. They bypass the process altogether, they bypass the waiting list, they see a situation that they believe is urgent and needing attention, and they implement the transfer. So of course that is not fair to the people who have followed the process and who are on the waiting list. And perhaps the most perplexing unfairness that we found with respect to the waiting list is the third. There are 1,400, as of December 5th, there were 1,413 approved applications on the waiting list for medical or safety at risk transfer. Those 1,413 households have had their applications approved, and they believe that they are going to consequently be transferred to a new unit. More than 75% of those households have been on that list for more than 2 years or more. Excuse me. So I just want to unpack that third unfairness of the waiting list, if I may. The waiting list is bloated and stagnant, and there are a few reasons for this. One of the reasons has to do with the legislation and the ranking of different priorities. The highest ranking priority by provincial law is one that the province has set, and it's mandated, and it's a very specific priority having to do with domestic abuse. The second highest priority is called overhoused, and the overhoused priority is one that the City of Toronto, as service manager, has created. And it was created in order to ensure that people living in a unit that's bigger than what they need will be moved out of that unit so that the unit can be used for families who need it. There's a shortage in the Toronto Community Housing portfolio, as I'm sure you know, of larger units. So those larger units are at a premium, and the city as service manager wants to ensure that those large units are optimally used. And then the third priority is this priority, which TCHC created, called medical and safety at risk. So you see on the slide, as of December, the number of households that were on each list. The provincial list had 13, overhoused had 1,328, and medical at safety and safety at risk, as I mentioned, had 1,413 households on the list. And those have to be accommodated in the order in which you see them there. So this shows the length of time that these approved households have been on this particular list that we investigated, medical and safety at risk. I mentioned that more than 75% have been there for 2 years or more. In fact, more than 54% have been there 5 years or more. We found that this is unfair in many respects. So we made 21 recommendations in our report, and we said that they should be implemented as soon as possible. The highlights are these. We recommended that the city, as service manager, should create a new category called, a new priority transfer category called crisis, and that crisis category should rank above the overhoused category. The households that are truly in crisis because of medical or safety concerns that relate to their unit are more pressing need, in our view, than even the overhoused. We recommended that the new crisis category have clear and narrow and specific criteria so that they can identify households whose current unit presents a direct, immediate, elevated, and acute risk to the health or safety of someone in the household, and a risk that moving to a different unit would address. We recommended that TCHC establish and clearly communicate a fair process on how tenants can apply for this crisis category, and also a fair process for how TCHC will evaluate the applications to determine who qualifies. We also felt it was very important that once households are approved, there needs to be a fair and effective way to serve the needs of those households. having people sit on a waiting list for 2-5 years is not serving their needs. So once the crisis households are identified, TCHC has to have a process to quickly and effectively understand the needs of that household and meet those needs with a transfer. We recommended, that TCHC seek outside help in developing this process. The city can help, the police can help, there are medical resources available for them to help, for them to access in order to make the process fair and effective. And the final one of the highlighted recommendations is that we recommended TCHC should stop adding to that bloated and stagnant waiting list of 1,413 households and decide what to do with the list, but certainly stop accepting applications to simply add to it, because that list is, as I said, creating false expectations and really not being honest with TCHC tenants. Both Toronto Community Housing Corporation and the City of Toronto reviewed our draft recommendations and findings, and both have accepted all of them. Their responses are on the screen. TCHC has committed to having the new crisis transfer category established and operational by June the 30th. And that will, of course, require the city to make it a higher priority than the overhoused, and the city has agreed to that as well. Also, I think it's notable that the city has expressly committed to support and consult with TCHC staff as they make these changes to their processes. So in closing, I'd just like to acknowledge the staff of Toronto Community Housing Corporation and the tenants, all of whom provided excellent cooperation to us. This was a very involved and extensive investigation. It required a lot of documents to be shared and a lot of witnesses to be interviewed, a lot of hours spent providing us information, and we really are grateful for that. Also, I want to acknowledge TCHC for its unequivocal acceptance of our findings and recommendations and its commitment to implement them. Also, the city's SSHA and SDFA divisions who were open to our recommendations, which required them to change the order of things, and who have also accepted and pledged to implement them. And of course, I'd like to thank my team for their characteristically excellent work. Those were my remarks, Madam Chair, and I'd be happy to entertain questions.
Okay, we do have TCHC here as well, so if members have questions to Toronto Housing. So, Councillor Pasternak.
Thank you. Thank you, Madam Speaker, and thank you for this report. It's certainly informative and educational. What strikes me is the people who have some kind of underlying medical condition that is related to their housing and safety at risk seem like two different kind of issues that are affecting our TCH residents. Is it safe to say that the medical would be someone who had a serious underlying medical condition or a terminal illness, and they need an internal transfer because of any kind of financial hardship or any kind of assistance or aids needed within the physical design of their unit?
I'm sorry, through you, Madam Speaker, I'm not sure I understand exactly what you're asking.
I'm looking at these medical cases. Now, you've described them as a list that would hold the household has a serious medical condition and that medical documentation is needed. My question is, are these people with underlying medical conditions that can be described as terminal illnesses, and would they have to change units? Is there a request to change a unit because of physical barriers within their unit because of their illness, or because of economic hardship that they need savings so they can pay for various medical treatment?
The current criterion, through you, Madam Chair, the current criterion for medical priority states that a member of the household has a serious medical condition and a licensed healthcare practitioner has determined that the current accommodation substantially aggravates it and a different unit would substantially improve the situation, and or that there was a distressing event that occurred in the unit that's substantially aggravating the medical condition. So it's very much tied to the circumstances in the unit and the medical circumstances of the household member in question.
So people who are safety at risk seem to be a totally different category. They seem to be someone who may be targeted in a local community, who may be subject to criminality or targeted by criminal elements. I'm just trying to think how we ever got on a list where someone with an underlying medical condition or terminal illness could ever be on the same list, and how anyone could possibly measure the desperation or priority of those two groups. How could you ever compare who needs housing, the transfer faster and more desperately?
Do you want to ask Toronto, do we have Toronto Housing here?
I'd be happy to.
Yeah. Does anybody from Housing want to answer that question?
Thank you. Through
Yeah.
you, Madam Speaker. That would be part of the process of defining.
You don't need to stand. Yeah.
Stand, but I just can't
press the button. Press the button. Is it pressed? Okay, try now.
My apologies,
Okay.
and through you, Madam Speaker.
Okay.
That is the very first and important step in the process, is to define what that crisis category is. And to get that as right as we can get it, that's one of the reasons why the Ombudsman, I believe, recommended that we do consult with outside experts. So we do have those experts helping us define what crisis is in the context of the process that we're going to establish.
All right, I guess I'm going to have to ask my last questions very quickly. I was surprised at the reference of local decision-making powers to approve a transfer, whereas the former Housing Connections and Councillor's Office go through a central list. How do we ever reconcile the fact that local decision-making is driven by a overhead by a central list? Is that?
Again, through you, Madam Speaker, if I understand the question, there's two things. There's a list that's administered by city, which is maintained to put people into our portfolio. The internal transfer process, which is the subject of the Ombudsman's report, is one that we administer in accordance with the provincial requirement and also the definition that the city had established for overhousing. So the internal transfer process is one that we administer, that we readily admit has been flawed, and we're very committed to make it work for our tenants.
So I can squeeze in probably one more question. When it comes to the category of safety at risk, are you working with police services on witness protection or any kind of other help police services can provide to make sure these families are safe and secure? Or are you on your own?
No, generally speaking, we cooperate with the police.
But are they helpful?
Yes.
Last question. Staff on weekends. I understand we don't have any TCH employees on weekends, and that's when most of the trouble occurs. Would that be a safe assumption?
Okay, thank you. That was your last question.
Yes. Our community safety unit, which is responsible for safety and security of our tenants, work 24 hours a day, 7 days a week, 365 days a year. And we're also sensitive to the times of the day when most of these incidents occur, and they have very good cooperation with the police.
Okay, thank you. Before we continue, I should have, I want to introduce Kelsey Milsom. She's the new CEO of Toronto Housing. For those members of council that don't know who you are, welcome. Councillor Doucette.
Thank you, Madam Speaker, to the Ombudsman. Obviously, I was very saddened to read this report you've got before us. Could you just please walk us through the process? It got a bit confusing. A resident comes in, whether they've got paperwork or they don't have paperwork, and they come to the on-site staff. What did you find the staff were doing and what weren't they doing? And then where does it go from there? Where should it go from there?
Through you, Madam Speaker, what we found was that what the staff was or was not doing on site, the staff who is there near where the applying household lives, was extremely uneven, and there was a very uneven understanding among staff about what their obligations were. So in some cases, staff were extremely helpful and were guiding households through the process, helping them to gather information, reviewing the application package, suggesting additions, helping them to go and solicit the further documents required. But in other cases, when we spoke to the on-site staff, they said, well, this is not my job, and you know what, the application requirements are clear and the tenants can follow them themselves as far as I'm concerned. So the unfairness really was in the great disparity in the amount of help that tenants were getting in putting together these packages.
One of the things you mentioned in your report was something about a summary sheet. That you were saying, I believe, should have been filled out by on-site staff because they actually know the tenant. Is that correct? And in some cases, if I'm not mistaken, when it gets to the next section to be approved, if that summary report wasn't there, that might have been a reason they were rejected.
Yes, the summary sheet is a very important part of the application through you, Madam Chair, and it should, in fact, that's the purpose of the summary sheet, is for the on-site staff to check to ensure that the application is complete and contains all the relevant and required documents.
Where does that package go once it leaves the on-site office?
It goes to head office, where the centralized tenant review committee process kicks in.
And are they responsible for helping get whether it's a doctor's letter or a police report, or has that already been done?
They're not responsible for that. There again is some uneven process, and in some cases where the staff there notices a deficiency in an application, sometimes it can be sent back to try to remedy the problem. But the way the process is supposed to work is that all of that work of ensuring that the application is complete and that all the tenants' concerns are reflected there is supposed to happen at the site level with the on-site staff.
And then from there, it goes to the review panel, I believe. Is that 3 people who sit on the panel?
Yes, it's a rotating panel, but yes, 3 people make each decision.
So who right now is on this 4,000, 5,000 waiting list? To me, it sounds as if it's a mixture of people just put as per date they actually sign up.
It's not 4,000 or 5,000 through you, Madam Chair. It's 1,400.
Oh, sorry, apologize.
No, I just don't want to exaggerate the large number. It is a collection of people, households, whose applications have been approved for many years. I don't know how old the oldest one is, but
this is a mixture
more than
of
5 years.
Medical, it's a mixture of overhoused, and it's a mixture of needing to or wanting to move for safety reasons.
No, the 1,413 is all one priority level, which is a mixture of medical and safety.
Okay.
The overhoused is a different 1,300 households which rank above the medical and safety list.
I'm going to jump very quickly to TCH, please. I've got less than a minute left. I know there were some changes in 2016. How much training did your staff have? Or more to the point, now we've got this report, how much training will the staff have so that each office knows what is expected of them so it is universal across our system?
They will receive considerable training. There's no question that the process itself was flawed. The training was lacking at that point in time. I think employees were trying to do the best under the circumstances, and we're very committed to making sure that we fix the process and we provide our staff with the training that will be necessary.
Another point in the report, and I'm going to ask you as well, the letter, I don't know if you call it a rejection letter or a letter that they don't qualify. I've had residents come to me, show me this letter, and it's just it could be taken out, name included, and signed at the bottom and a date put. Will you be changing that and actually putting into that letter something which refers to the person who's actually requesting this so they really understand why they have been turned down?
That's your last question?
Absolutely, through you, Madam Speaker. The communication element is going to be critical, both in terms of how we engage tenants, how we communicate back with them, and how we continue to update them with respect to their status on the process.
Thank you. Councillor Mihevc?
Yes, thank you. To the CEO of TCHC, how many staff are involved in the relocation work? Both maintaining the list, facilitating transfers, that kind of thing.
I think that's probably part of the problem, because it's a lot of our operating unit staff, so our frontline staff, and that was part of the challenge in terms of the consistency of the process.
So do you have a dedicated unit for this?
Through the process that we're going to be looking at, we will be establishing a dedicated process, including an audit process, to make sure that not only do we train our staff, but that we're following the process ourselves.
So right now, there are no dedicated staff doing this work. Is that fair to say?
Through you, Madam Chair. We do have a centralized transfer review committee. As the Ombudsman noted, the local staff are responsible for gathering and in principle assisting tenants in gathering the requisite documentation. There's about 110 tenant service coordinators doing that work. Once the package is complete, it's sent down to a review committee. That's comprised of 3 people who do the assessment, but as the Ombudsman noted, that membership is rotating through about another 25 people. And so, to your point, that's the scope of people that will be involved in training and changing the process.
Would it be fair to say then that currently this is staffed? The staffing model is that it is a piece of many people's work, but not the whole piece of anybody's work.
That's correct, and that's one of the contributing factors to why the process wasn't working effectively.
Right. To the Ombudsman, so we do have a company for people outside the social housing world who want a social housing unit. And we have a separate company that manages the list, and sometimes they're a pain in the neck because we're always trying to, as councillors, jump the queue for residents that we're supporting. But you know what, at the end of the day, we begrudgingly admit that, you know what, it's pretty fair. They know what they're doing. Do you think that it is a better system to have this service as an in-house service for that company, TCHC, and every other affordable housing provider? Or do you think that they might consider perhaps grouping this and asking Toronto Housing Connections to centralize that list so that there may be some possibilities between housing providers?
Through you, Madam Chair. Councillor Mihevc asks a very interesting question. It's not something that we looked at. Certainly, you know, if the new crisis category doesn't unfold the way it should and doesn't result in a fair process and fair outcomes for these tenants in need, then perhaps that's something that Council will wish to entertain, but it's really not something that we looked at.
Well, could I ask the same question of the Executive Director or the CEO of Toronto Community Housing? It's obviously a complex maintaining list. You think it's simple, but it's obviously a complicated piece of work. Is this something that you think TCHC may want to consider centralizing with Toronto Housing Connections?
Through you, Madam Chair. So one of the things to consider when doing that is that the city manages or oversees 241 service providers. TCHC is one of those. So I think in the short term, as we work with TCHC to create the new crisis category and they implement their new processes, we might want to look at how that works out and then consider the broader implications of the other 240 providers.
You wouldn't want to do that, consider that even off the top. And I'll just give you an example. You might have, well, I have TCHC beside some co-ops. Co-ops might have a space right around the corner, but they have their own waiting list and they have their own bumping process and internal displacement process. It would seem to me that that might make more sense if there was a centralized list, which was the original inspiration, frankly, behind Toronto Community Connection, or Toronto Housing Connections.
So I think the issue is the operational processes that are undertaken for the particular list as opposed to this list itself and that new priority to be set up and a very focused priority for those individual clients. I think the process is exceptionally important. When you get into the other 240 providers, some of them would have an individual building, which would be much more complicated in terms of creating a new priority category for them.
Right, okay, thank you.
Thank you. Councillor Jamari, questions?
Thank you, Speaker. Ombudsman, you had said there are 13,000 households on on the waiting list? What was the exact number?
On the medical and safety at risk list, there are 1,400. On the overhouse list ahead of it, there are 1,300.
1,400
Yes.
on the medical.
Medical and safety. And then on the overhouse list, which ranks above medical and safety, there are 1,300.
And you recommended at one point near the end of your delivery that there should be no more names added to the list, but I can't find that in your 21 recommendations.
Oh, let me help you.
Please.
It's at recommendation 18 through you, Madam Chair. What we said is that TCHC needs to decide what it's going to do with that existing list, but that even if it decides to keep the list for whatever that priority is actually worth for tenants, we recommend that they stop adding to it.
And what do you recommend, where do you recommend that these people go?
What we recommend is that they be informed of their eligibility to apply for the crisis priority if they believe that their circumstances warrant it. But besides that, we feel it's really up to TCHC to determine what other accommodations or arrangements TCHC is able to offer them.
If and when the crisis priority process comes into effect?
Correct.
Could you explain to me what exactly you mean by the overhoused?
Yes.
The 1,300?
Overhoused is defined. If I could just have a moment.
I know that.
So the overhoused category through you, Madam Chair, is a category that the city created, and what it means is that it's a household who has, do we know the exact definition? I'm not sure of the exact definition. Perhaps TCHC or the city could better answer the question, Madam Chair.
So my point in asking is, how do you think, Madam Ombudsman, that the two are related? Would you assume that the overhoused would be switched so that the medical and safety applicants would go into those so-called overhoused units? Is that why you raised them both today?
Through you, Madam Chair, that wasn't what I intended to imply. The reason that the overhoused list is even relevant to this discussion is simply because it's a higher ranking priority than medical and safety. So when tenants are approved for medical and safety priority, they would understandably believe that they're going to be transferred. But what they would not understand, I expect, is that that's actually not going to happen because there are 1,300 households on a different list with a higher priority that is also bloated and stagnant and not moving.
So this one needs some explaining. Are you saying that those that have 4 bedrooms and only need 2, for example, just a number pulled out of the hat, should not be on that list that is given higher priority?
I'm not saying that. What we've recommended through you, Madam Chair, is that the households on the lower priority list, the medical and safety priority list, who are truly in a crisis situation, should have a higher priority than those who have too many bedrooms.
Thank you.
Thank you. Councillor Baila.
Thank you, Madam Speaker. I actually want to follow up on the questioning from Councillor Ajimere. I actually would like to understand if in the 1,480 households that were in the crisis, was there any analysis done on what kind of home they needed? Is it the majority a 1-bedroom? It's the majority 3 bedrooms? It's the majority? What is it?
I think that maybe Toronto Housing can answer that
Yeah, I don't think I have that information through you, Madam Chair, but TCHC might.
So my question, I don't even need the answer.
Okay.
My question is, was the analysis done on the overhoused as well?
We did not analyze the overhoused list.
So the relation between the overhoused and the crisis, even though you're recommending to not have the overhoused, my concern is there was actually not an analysis done to understand if it could have an impact. If the majority of the households in the crisis management are, for example, looking for 2 and 3 bedrooms, and the overhoused, the majority of them are people waiting for smaller units, actually us making that a less of a priority is going to worsen the situation because we didn't do this analysis. Would you agree with me? There's a possibility.
Through you, Madam Chair,
I'm concerned that there was.
I'm not sure I agree. I don't think I agree with you, but I'm not entirely sure that I understand the question. We're not recommending elimination of the overhoused priority, and we didn't look at the overhoused priority. The overhoused priority is not people seeking to transfer. The overhoused priority are households that TCHC has identified as taking up a larger unit than they need. And if they stay on that list for longer than a year and don't cooperate in accepting suitable offers, they fall off.
All that.
Okay.
But if the majority of the households, and I don't know, I'm just concerned that this analysis has not been done. If we need those households that people are overhoused, if the reason why this list is not moving because people are sitting on these bigger houses for way too long and they actually don't need it, we need to address the household overhoused first in order to tackle this one. And I'm just concerned that that analysis of numbers has not been done.
I don't know whether TCHC has done it. Through you, Madam Chair, we did not do that analysis.
Do we know what's the turnover rate at TCHC per year?
It's 5% per year.
5%. And so the 1480 households that we have is 2.55%. So we have 2.55% waiting to be relocated when the entire portfolio has only a turnover of 5% to deal with this, the overhoused, the people on the waiting list, to everything, all the priorities that we have.
You are correct. The fact that we have a very low rate of turnover exacerbates the problem in terms of us being able to accommodate those people in need.
Thank you.
Okay. Councillor Fletcher, you are up. Councillor Fletcher.
I am here now. Thank you very much. I am just wondering if you were aware, and I noticed in your report there's a number of times you speak about people who had done their good job, put in their transfers, and then were told that they needed materials from the police, and then it looks like they had to go and get those from the police, and as a matter of fact, you had to go and get some that I read. I'm wondering if you are aware that there is supposed to be a process where the operating unit managers or district managers meet regularly with the divisions, police divisions, around issues in Toronto community housing or for the community. Are you aware that that happens?
That was not something that was raised during our interviews. So no.
You weren't aware that that was happening? And
no, through the chair, no.
You're not...
But that type of interaction with the police is something that we feel should be happening so that the best quality of information can be available for these decisions.
If it was happening, and I'm really speaking not about someone who's got noise or someone who has smoke issues or anything medical. I'm speaking about real safety, gun violence safety matters. If those weren't raised in those face-to-face meetings and that paperwork wasn't transferred at those face-to-face meetings, would that concern you?
Through the chair, that would concern me. What we found was actually happening was that households would request police documentation and the police would say we can't give you any.
Would you agree with me that if there is a safety issue in Councillor Burnside's unit here that he wants to move from, that Councillor Cole and myself also are at risk because we're right next door to whatever safety issue is taking place. Therefore, it's not just a matter of Councillor Burnside, I'm sorry to always use my example, but that there's a larger community safety issue with anybody who needs to be transferred for safety at risk.
Through the chair, I think it depends on the nature of the risk. There could be a general community risk. There could be a specific risk connected to a specific member of the household.
And I'm speaking about gun violence, and I'm sure you've been very aware of the types of gun violence, and that here somebody's driven by the house and put 2 bullets through that window.
Certainly in that circumstance, more than just those people were at risk.
When someone has been moved, would you be surprised to know that a reprisal was through somebody else's window, not the original safety at risk tenant? Would that surprise you?
Through the chair, that would not surprise me.
So I'm just going to ask TCHC now, and I just first of all want to preface by saying I'm very happy that Ms. Milsom's here as our new CEO and has taken this bull by the horns, and you've walked into this. But how often and when and where are your OU managers or other higher level managers required to meet with police about the communities, and how does that information come back up, and how are they identifying problem properties to you?
First of all, thank you very much for that, through you, Madam Chair. Safety is top priority for us. There's no question about it, whether it's physical safety or it's fire safety, and we're committed to improving every way we can. We have very good cooperation with Toronto Police, and there's 2 ways that we engage with them. We engage with them with respect to community safety, so that's more holistically in terms of looking at what's going on in the community, how we can better cooperate, and how we can seek to reduce crime. And the other aspect of it would also relate to this particular issue with respect to the crisis category, is with respect to case management.
And how many meetings were there with the police divisions in the City of Toronto and managers in the month of January where this type of information was passed over?
I'm sorry, I don't have that information, but we can undertake to get it to you.
Is that not something that you track?
We do track the interactions, and we can get the information to you.
So so are you surprised, having tracked that somehow tenants are left on their own getting a police letter, when I would think the police and management at the ground level would be interested in solving safety at risk problems, because it's putting the entire community at risk? Did you not find that odd?
I would like to emphasize again that we absolutely agree that the process is broken and needs to be fixed.
But it was,
with respect to individual cases, so where there is an incident that we need to look at, we deal with the police directly, and to the extent what we can, we do help the tenants in terms of getting whatever documentation they need.
I'm over my time. Thank you.
All right. Thank you for your honesty.
Thank you. Councillor Burnside.
Thank you, through you, to the Ombudsman. You mentioned that there's about a 2-year waiting list for some transfers, I believe?
Over 75%, or
over 75%.
75% have been waiting for 2 years or more.
Okay. So if you say that your suggestion is to sort of say, do the crisis people in the crisis category first, and then the overhoused after that?
Through you, Madam Chair, yes.
Okay. So would that not, there is obviously a need to move the overhoused people so that the whole system actually works. If you're looking at 2-year plus waiting lists, would that not throw the whole system of actually moving the overhoused out of there totally into disarray?
Through you, Madam Chair, the idea is that the crisis category will not have a 2-year waiting list. If the crisis category is properly designed and implemented as we've recommended, then people whose applications are approved will be moved very quickly. They'll have a limited number of opportunities to turn down offers. Their needs will be quickly and effectively assessed by TCHC, and their new units will be offered to them, and they'll be moved. It's to get away from this long wait that we are suggesting the most serious circumstances, the crisis cases, get identified.
But wouldn't necessarily, if you put more emphasis on one area, that would necessarily mean less emphasis on the other, unless you're suggesting more resources?
Through you, Madam Chair, certainly putting the crisis category above the overhoused category would have some effect on the overhoused, on the speed at which the overhoused can be moved.
Right. Back to my original question, would that not cause issues in the overhoused, the area of dealing with the overhoused tenants?
Through you, Madam Chair, I think there are a lot of questions, and we could do someone could do another investigation on the overhoused list, because after 1 year, if families are not cooperating with accepting reasonable offers, then the legislation says that they should lose their rent geared for income assistance and be moving out. Why there are 1,300 households sitting on that list, I don't know.
Okay. And so is it your, from your investigation, I think, if I understood Councillor Bailão, I think maybe where she was getting on one area is it your belief that the TCHC can't handle both issues concurrently? Like, you're kind of putting them in silos. And I know that's one of the problems with government in general, is when you start putting things in silos, that actually creates more problems. But is that kind of the direction you're going?
Our findings in this investigation through you, Madam Chair, is that TCHC has not been handling this priority effectively. Whether they've been handling overhoused effectively or not, as I say, I think could be the subject of another investigation and a whole other series of questions. But certainly, we were looking at the medical and safety at risk process, and it has not been properly handled.
Right, but just to confirm,
are
you then suggesting that they look at these various situations in silos?
Through you, Madam Chair, that is certainly not the intent. The intent, we're, for example, not saying just flip these two priorities by any means.
Okay.
What we're saying is you have this huge number of households that's been approved, that you've agreed with the fact that they have medical or safety concerns with their unit. Find a way to identify the really, really serious ones and serve those tenants. There's not a lot you're going to be able to do for the remainder, it appears.
Okay, and lastly, so I have dealing with a situation right now where there is actually a safety issue, but the tenant only put down X number of addresses he or she would be willing to move to, which are like, might be at Yonge and Eglinton. And so that's causing a problem. How is that addressed in the report, or did you address it?
That is, through you, Madam Chair, that is, Madam Deputy Chair, that is definitely a factor and a problem and an issue with respect to the bloated waiting list. The way we address that is simply by urging TCHC in the new crisis category to have a more focused way of identifying the needs and serving the needs, and allowing only a very limited number of refusals before they leave that list and make room for somebody else.
Oh, sorry, so you did say a limited number of refusals?
We did.
Okay,
last
thank
question.
you. Appreciate it. Thank you.
Thank you, Councillor Burnside. Now, Councillor Crisanti said he only stands up when it's terribly important, and now here you are standing up again. Go ahead, this is terribly important.
Speaker, this is very important, and thank you to the Ombudsman for your report. And, you know, I have up in the North Etobicoke Ward 1, in the Northwest Corridor, like I have a number of requests of safety at risk type of requests that came directly to my office. And so I just want to clarify something in your report that speaks to the medical, the chart that you have on page 5, which is the medical safety at risk priority transfer. So are there different categories of safety at risk, or are they all bundled into the one category?
Through you, Madam Chair, the trouble with one of the troubles with the current process is they are all bundled together. So
the medical and safety.
Medical and safety, and also every type of medical and safety concern, all bundled together and all just put on a list according to the date on which they apply.
Okay, so you're suggesting that be separated and create a new category. How is that going to help? The numbers don't really change.
Through you, Madam Deputy Chair, our suggestion, our recommendation is not that the medical and safety be separated, but rather that TCHC devise a new category to identify the truly urgent situations, be they medical or safety related, where immediate transfer is truly required.
Okay. So, and I think one of your recommendations also makes reference to stop accepting applications. Was that correct? Did I read that correctly?
Through you, Madam Deputy Chair, we recommended that they stop adding to that current list of 1,400 households under the current medical and safety priority.
Yeah,
yes.
Well, we have serious issues along that line, and when people call my office and they say they need help, the last thing I think we want to say to them is, well, I'm sorry, but we're not taking any more applications. I think there needs to be a way of continuing to deal with that. Would you agree with that?
Through you, Madam Deputy Chair, the intention is not to stop taking applications until the new crisis category is in effect. And anybody in TCHC, whether they're on the existing list or not, will be eligible, if their circumstances warrant it, to apply for the crisis category.
Okay. And have you had discussions with Toronto Community Housing around designing recommendations on what more can be done to improve the level of safety in the problem communities across the city, and certainly in the northwest end of the city where we have a couple of those, and we need more attention in the area of making those communities safety. Was there conversation between your office and Toronto Community Housing with respect to that?
Through you, Madam Deputy Chair, that is not a general topic that we discussed with Toronto Community Housing.
Then maybe I can ask that of Toronto Community Housing, because I know I heard you say earlier that you have regular dialogue with the Toronto Police Service with respect to this precise question that I just asked. Are you currently having dialogue in terms of what other steps you can take in terms of, in trying to assist communities in need of improving safety within those communities, and what additional steps they can take?
Absolutely. We're very much committed to improving safety. We are adding additional 12 special constables this year and many, many more additional CCTV cameras, which both act as a deterrent and also to help apprehend individuals who are involved in crime. And just yesterday afternoon, I had a meeting with the head of our community safety unit to see how we can ramp up our dialogue with Toronto Police to make our communities safer.
Okay. And so I'm really happy to hear that you're adding special constables. Can you tell me how many are you adding, and will you also be discussing with your team of special constables the way that they are engaged in the community in terms of being maybe proactive, boots on the ground? They used to do that. I could tell you, I know they were doing that years ago. They're no longer doing that, and that is a real important way of policing, just much like the modernization of the Toronto Police Service, where, I've been very vocal and focused on getting more boots on the ground in a sustainable, consistent way. Are you having those discussions to ensure that that's done in a sustainable way?
Yes, we are.
And has it started? Is it going to start soon?
The discussions have started. We're hiring 12 additional special constables, but again, we've got a very large portfolio, and that's why we need to work very collaboratively with Toronto Police as well. We want to get our special constables out there. We want the boots on the ground. We want them to engage with the community, so they're known and they know the community.
Excellent. Thank you.
Thank you, Councillor Crisante. Councillor Palacio? Wait a minute.
Thank you, Madam Deputy Speaker. Through you to the Ombudsman. When I was a member of the Toronto Community Housing back in 2011-12, there was a report from your previous predecessor, and with the report, it was a lengthy report with 81 recommendations that had to do with medical safety issues as well as the waiting list. So that was one of the reports that brought light to this council in terms of correcting the wrongs by then. And it was suggested that the Toronto Community Housing system was broken and it needed to be fixed. So that was by then. So everything humanly possible was done through this council and through Toronto Community Housing to correct the wrongs. But here we are with your report. So I'm trying to understand what has been done in relation to perhaps what's going to be done and how to reconcile what's happening there. Can I get your perspective on that, please?
Through you, Madam Deputy Speaker, my office before my arrival did a number of investigation reports respecting issues at Toronto Community Housing, ranging through a number of different types of issues. I'm not sure that I know exactly which report Councillor Palacio is referring to.
Well, it's...
And
that's fine. Thank you. Some questions to the Toronto Community Housing. As at the end of the year, how many vacant units did we have? And I mean rentable and unrentable units.
1,372 units.
Those are rentable units or unrentable?
Rentable, correct.
And how many unrentable units?
2008.
So altogether, we have between those rentable and unrentable units almost to 3,380 and something, right? You mentioned 1,372 in 2008, so that would be 3,300.
Through you, Madam Chair, we have 1,372 rentable, meaning those are units that we can offer. Of the other 2,000, they're out of circulation because they're either in need of capital repair, meaning that they're uninhabitable. 1,000 of them are actually currently in redevelopment, meaning they don't actually exist. They're part of our Regent Park and Lawrence Heights redevelopment. And we have a few others that are being repaired for accessibility reasons or being held because we're using them as storage spaces for capital repairs that we're doing. We're deploying an unprecedented amount of capital this year. So when you consider it that way, there's only a few hundred that are unrentable, and we currently have capital plans to bring them back to rentable status.
So we are dealing with a housing crisis for a lengthy list of tenants that we have out there. And you just mentioned that we have units for storage purposes. Is that what you just said?
Through you, Madam Chair, yes. There are certain communities, and you know the demographics of some of our spaces, where there are not logical storage spaces for us to put and mobilize large construction projects. So where there are some units in those communities that we can leverage for short periods of time to facilitate construction works, we will use those. But we look strategically at where we're using those relative to where there's demand for units to put into the rentable stock.
So here we are dealing with a tremendous crisis with the homeless people out there. So I'm just wondering, with all this number of empty units, where the priorities are in terms of making sure that we are going to capitalize on what we have already instead of keep on wasting money out there. So I'm just trying to understand. I'm not a member of the board anymore, so I'm trying to understand what's been done, if we are dealing with a top-down approach, or what's the process.
One of the issues that we had as an organization is that we didn't have enough capital to repair the units. And now that we have the capital, we're putting that into the units to make sure that they're back in the housing stock as quickly as they can be. It's also important to note that when we talk about how many vacant units we have, that's not stagnant. Those are turning over. So as people vacate, we very quickly put them back into rentable condition and offer them up.
Thank you.
Thank you. Councillor Karygiannis.
Thank you, Madam Speaker. Through you to staff, TCHC staff. Congratulations to your appointment, and I believe this is probably your first City Hall encounter, so welcome. Got a couple of questions for you. Out of your portfolio, let's say of 100% money that you have available, what percentage of that is on executive salaries?
Yeah, I'm sorry, I don't have that information right off the top of my head.
Yeah, but I'm sorry, Councillor, this is not what's before us now.
Madam Chair, for me to ask you questions, there's a purpose behind it, and that's why I was asking it. But if they don't have it, I'm sure they can get it for me. I was wondering, through you to staff, Madam Chair, Morecambe-Gate, Chester-Lee are in my riding, in my ward, and there's been 2 fatal shootings in the last 2 years. I was wondering what steps you've undertaken in order to make sure that my constituents are feeling safe.
Through you, Madam Chair, that is a high priority community for us. I was out there for one of the events where I believe I met you as well, and we're very committed to doing what we can, working with Toronto Police collaboratively to make the community safer.
Earlier on, you answered one of my colleagues, and you said that you had meetings with the police, and you were able to get feedback. I was wondering if you or your staff can tell me how many meetings with 42 police stations there have been in the last 2 years since the shootings have taken place, and what were the results of those meetings?
I'm sorry, I don't have that information with me.
Okay, I hope that you undertake it to bring it to my attention then. Thank you very much, I appreciate it.
Councillor Wong Tam.
Thank you very much, Madam Speaker. I want to, I think my question will be first directed to, I'll let whoever can decide on how they're going to answer. With respect to the priority transfers that are set out in the policy document, some of it is provincially mandated, some of it is City of Toronto mandated. Is there a way of consolidating these 6 categories, special priority, overhoused, temporary relocation, medical and or safety at risk, underhoused, and non-priority requests? It seems like a lot of priorities. Is there a way to narrow that down?
Happy to defer to Ms. Milsom on that.
Thank you very much. Through you, Madam Chair, we're going to take this opportunity to look at our entire internal transfer process. So obviously there's a lot of improvements that we have to make, and through this review we believe that we can apply a lot of those recommendations, a lot of those findings to improve the process overall.
Oh, I see. So the recommendations from the ombudsman would, the 21 recommendations, you think you can take them and apply them to the different categories that are before us as priority categories? Because I guess I'm wondering if there are some challenges with respect to staff knowledge or consistent application, clear evaluation, and transparency. If it's in one category, I suspect that we'll probably find some of those barriers in all the categories.
I agree.
And so then do you need further direction from this council to do that work, or is this something that you've just committed to doing right now?
We've taken ownership of that. We're committed to doing it.
Okay, I see. And I want to understand, like, with respect to the evaluation process, because oftentimes we work in the world of paper. I've got lots of paper on my desk right now, and things get shuffled, and I've heard consistently, not necessarily about this particular subject matter around priority lists, but I've heard consistently about tenants having their documents lost or having to start over all again, perhaps the process being rather onerous. Is there any adoption of technology that TCHC can use so that therefore it is consistently tracked? There is one file per the person that follows them throughout their entire time at TCH?
Through you, Madam Chair, again, that is an area of focus for us as well. We have 176 tenant-facing applications that not only do not communicate with each other, they're DOS-based. They're very outdated. So we have started a process of implementing a new integrated housing management system which will enable us to be more efficient, effective, and provide better services to the tenants.
And do you have the resources that you need in order for you to create this system?
Yes, we do. It's in our current budget.
And how long will it take until it's number one, up and running, and where staff are able to be fully trained, and where you will no longer rely on paper documents?
Unfortunately, it won't be a fast process because we have to do it well. We have to look at our processes so that we're setting up the system with appropriate processes. We have to look at our data integrity, and we've only started the process now. So we're going to develop a work plan, but we're about 2 years out.
Oh, so in approximately 2 years, you think that it will be complete? Is that correct?
Correct.
Okay. Thank you very much. That's helpful.
How is it 2 years? Thank you. So that's it for the questions. Councillor Fletcher, you held the item down to speak. Oh, okay. Yeah, just one sec. I believe that you have a motion. Okay, Councillor Fletcher to speak.
Yes, I do have a motion, and I'm asking, it asks for the Ombudsman to report back to Council in Q1 2019 on the progress of the implementation of the recommendations in her report. And one of the reasons I'd like this to happen, and I hope Council agrees, and it's nothing, nothing against our new CEO and her staff, but we can see how big the cracks were at times where things fell through. And I think it's really incumbent upon us in having this really fantastic report that we ensure that it is being implemented in an orderly way, that there is a new crisis category. And I would also think it's important that the service manager, the city as service manager, is really aware of what's happening here. And I did hear that there's hundreds and hundreds and hundreds of service providers. But I would like to note that there aren't hundreds and hundreds and hundreds of large service providers. So I'm unhappy with that answer, because if you look and see that there are the Wood Greens of this world, there are service providers that have hundreds and hundreds and hundreds of tenants, TCHC is not the only one that has, I'm going to talk about health-related moves or violence. So I think there's something to learn there from those who are working on a smaller scale, but not the small ones that EQ Home has a few locations. We're talking about some major providers. Those are our benchmarks, and those who would be our people that may have something to help us. And I think we also have to make sure that, I didn't ask the Ombudsman, but when we were hearing in the Tenants First, we had QP79 came, and they talked about how tenant service coordinators used to work before Toronto Community Housing, and how much more efficient that was, how they knew more things. So there aren't these two silos and these vacuums of those who are delivering service, maintaining, and then those who are dealing with these issues. Speaker, my time says 5 minutes and 50, but I don't have eyes in the back of my head.
I know, it's...
I'm here for you.
Thank you.
2:30.
Thank you.
Halfway.
So I do have to say that I am aware, having sat on our subcommittee with the Deputy City Manager who convened that after very unfortunate gun violence and murders and deaths in our first revitalization at Rivertown, that there is to be a relationship between the police and Toronto Community Housing staff in each community where they are reviewing issues. And I would think reviewing safety issues and reviewing them in a systematic way where information is going back and forth and up and down. I don't particularly get that impression from this report, and I get the impression that that perhaps hasn't been happening, because it's beyond me how somebody could have had a violent incident with guns fired, that is when the police come, and there's nobody in the local division or the superintendent there isn't able to quickly assist somebody in housing to make sure that tenant, if they need it, gets a priority transfer. Because when that tenant is being targeted in that location, that means all of the tenants are at risk. And sometimes those tenants are living right on the ground floor. Right on the ground floor, the front door is right there for everybody to get at. Maybe there needs to be a policy where tenants who are moved at risk, a certain type of unit, a certain space, to make sure they're not as available. And one instance in Blake Boltby where someone was moved for safety at risk, they were moved to a front door location. Somebody found out, came down, was going to, and shot a bullet, not into their place, but almost killed a little boy in the next door unit. There isn't enough thought going into it. In our communities, violence is number one. That affects absolutely everybody. I think people are tired of living through that. And I think the public certainly expects that while we are running and a great provider of social housing and affordable housing, that we have to clean up our act regarding violence, regarding guns, gangs, gangbangers, and everybody else. That's the category I want to see tackled immediately. I just happen to know too much about all these kinds of things over the years. I wish Ms. Milsom a lot of luck. I'm glad she's there. I'm glad her hand is on the tiller. I think she's going to deliver. but I do want to make sure that we get a fulsome report back that we're on track in January or in Q1 2019 for all of us who may or may not be here. Thank you.
Thank you. Councillor Pasternak to speak.
Yes, thank you, Madam Speaker. And I also would like to echo welcoming Ms. Milson to TCH and, of course, to City Council. We had a great first meeting in my office to talk about many of the challenges that we're facing in Ward 10, but it wasn't all negative. There were some great things happening with many of the 5 buildings that TCH manages, and of course we have another 5 buildings of affordable housing run by a third-party partner. To the Ombudsman, I just thank you for this report. It is most insightful, but I became a little frustrated in reading it, and I just told Councillor Bailo that I was going to move some motions. But you know, with this report, you don't know where to start. And I think supporting Councillor Fletcher's motion to bring this back for an update is really the only way to go. Why medical and safety at risk applicants for transfer on the same list? I just don't know. I mean, safety at risk is a police, law enforcement, witness protection kind of strategy where they have to be really in on the conversation. And I'm not a criminologist or an expert in police enforcement, but I can tell you that if you move units within the TCH family of buildings, you will be found by criminal elements. Moving units will not solve that problem. As for medical priority, we have had dozens of people come into our office over the last 7 years, hundreds. I have a staff member whose sole responsibility is to work with TCH applicants and tenants. And I can tell you that they come in with page after page of medical documentation, whether they're a new applicant or they've been on the list for 15 years or whether they're currently a TCH resident. And it would take a medical expert to go through these files and determine which should go to the top of the priority list and which don't. It's just a science that I don't think we're equipped to do. You need expertise in the medical profession to go through all this documentation. The overhoused phenomena is quite intriguing, but it's a mythology to think that it's kind of an offset, that if we move the overhoused out, we can move the underhoused in, or we can move people from this priority list in. The overhoused don't want to move. And they don't want to move because they're selfish. They don't want to move because they're comfortable in their neighborhood. And it's very important to remember that people want to stay in the building that they're currently in because of cultural ties, because of linguistic ties, because of national background. And that begs the sort of the other issue is when people are trying to transfer from building to building, they come in with their list, and this is where a councillor's office can help, and we take in many people at our office and offer advice from many people that don't live in our area of the city. And we look through their list, and it's totally inappropriate. The selection of the size of the apartment is inappropriate. The selection of the area of the city is totally inappropriate. And then when we make suggestions on where they might move and where they might have the best chances, they say, I'm not going to move there. Because of the factors that I just mentioned, whether it's linguistic issues, cultural issues, or proximity to family. I'm quite surprised in the references to the role that site staff have in the transfer process. I mean, I can tell you that's a big mistake to have on-site staff influential in the review and developing of the paperwork, to have a say or the power of who gets in and who doesn't. That's leading to all kinds of problems that we have heard rumors about throughout our portfolio of buildings. And similar to that issue, and I know I've discussed it with senior staff at TCH, that we seem at our TCH buildings to be overstaffed during the week and then understaffed on the weekend. And no one's saying that people should be working an extraordinary amount of overtime. They don't want to work the overtime, and we don't have the budget. But I don't understand why so many of our divisions at the City of Toronto, whether it's Toronto Public Library, Fire Services, Police Services, some of our facilities management, are there on Sundays. They work 4 days during the week, and then they work every other Sunday or every 3 Sundays. They rotate off. Why we can't use our human resources more effectively. And I would say, finally, that having these people who have suffered so much, who have waited so long, and who are frustrated with TCH to apply, to tell them to reapply to a brand new list, I think is an insult. And I think we should avoid that at all costs. But I look forward to the updates of this report. It's an important conversation, but it's certainly a tough task. Thank you very much.
Thank you. Councillor Cressy, you would like to make an announcement?
Just very briefly, Speaker, we have some guests here, and I'll just preface it by saying that if you're a member of City Council, you've probably at one point or another been given advice by blogger and author Sean McAuliffe. Well, he's here with the next generation of students who at one point also give us advice. This is a University of Toronto first-year class blogging the Just City, and we just want to welcome you to City Council. Thank you very much.
Thank you. Councillor Doucette to speak.
Wow, now I've got to be really careful what I say, right? Okay, I'm in trouble now. Yes. So first of all, I'd like to thank the Ombudsman for this report. As I mentioned earlier, I was saddened when I read this. I have several Toronto community housing properties in my ward, and I work very closely with a lot of the residents. I would like to say I'm looking forward to having my one-on-one meeting, maybe in my office or maybe on site. We'll see where we're going to go on that. But I am looking forward to that because I have always worked very closely with TCHC. As I say, you are a major part of our community in my ward and across the city. Thrilled to hear that you will be going back and looking at the training our on-site staff need, because I do believe they do need to help the residents at the initial stage of what papers do you need? Do you have your correct papers? That summary sheet is important. I agree in some respects to what Councillor Pasternak was saying, but they don't make the decision who gets on the list and who doesn't, which is good. They used to, but that responsibility has been taken away from them, which I agree they should not have that responsibility. So I'm thrilled to hear we're going to look at the training. We're going to make sure that each of our sites are doing the same thing. Also, really do push, and I think I heard a yes to this, when a resident gets a letter telling them they are not going to be put on that list, it's too generic. Residents bring these letters to me, they show me all their medical records they've gathered, they show me a police report they've gathered, and then they get this generic letter saying, "Dear Mrs. So-and-so, date, time, you don't qualify." They need to know why they don't qualify, because in this report it says they can come back and reapply. But if they don't know what paperwork they need, or they don't know why they didn't qualify, maybe they'll just keep coming and back again when we know that they probably may not qualify. So I think we've got to be honest with people up front as well. As I was reading this report, I kept thinking, okay, I've learned everything. I can finish reading, don't have to go through the whole pages. And then I'd turn another page and I'd learn something new. As much as I am saddened by reading this report, these reports are important. They're important for our on-site staff. They're important for the people who look after our TCHC residents. They are residents of our wards. They are residents of our city. And we have a responsibility to make sure that they are living in good housing where they are safe and they are healthy. I do agree that if there is a safety issue, those people should be given priority to move. When you have a family who has gone through, an example, a shooting, they can't live in that same community. The mothers won't let their children out. The mothers don't want their children to go to school because they're scared something's going to happen. We have to make them a priority to move them to a safe area where they feel comfortable. Yes, we get a lot of medical people coming to us thinking they have a medical reason criteria to move. We also need to let residents know, I think, what the criteria is. There's no point moving someone from one area to another if it's really nothing to do with a medical reason. It's just because there's something going on in a building which is probably going to go on in the next building or outside the building. So I agree with Councillor Fletcher's motion. Let's review this. Let's come back and see where we're standing. I know that as long as I've been in this chamber, which is since 2010, every recommendation put by both ombudspeoples, persons, ladies, have been accepted by City Manager and by TCH. So that shows that these reports are good, they're getting to the bottom of the issues, we accept the recommendations. I know we follow through on them, but I think it's always good to have a report back to Council so we can just double check everything is in place. Thank you very much, and I look forward to having our first meeting.
Thank you. Councillor Bailão.
Thank you, Madam Speaker. I'd like to thank the Ombudsman for the report, for all the work. The report is extremely helpful, and I'm happy to see TCHC executive leadership taking the report and actually saying this is actually the beginning of a complete overhaul that we're going to do, not only with this list, but with that whole system. Because I think that in some ways, I think the report falls a little bit short, is not seeing the connections that a few of the items have, and that was the point that I was trying to make through the connections between the overhoused list and the crisis list. You know, by just simply saying, yes, you should have this crisis ahead of any other list, well, we might need the unit that is being occupied by the overhoused family in order to actually service the family that is in crisis. So these things are very interconnected. And so I think that that data analysis really need to be done, and I applaud the staff at TCHC to say we're going to take it further, we're going to look at these numbers to see what actually makes sense. I think the process part of it is here, with the Ombudsman said, the staff training, the attitude changes that needs to happen, the process, the looking at the process is here, and that needs to happen. But that also needs a few things. It needs a complete new IT redevelopment look, not only inside TCHC, but actually within the city. You know, our choice-based program that needs to get going, to coordinate the work that needs to happen between the city as a centralizer with the TCHC, but also with the other 240 housing providers. And that needs to happen. And that's why it was important last year that we put the 18% increase on the budget of TCHC, and we continue to put it because there's major investments that need to happen inside TCHC, not only on the capital of the units, but actually on modernizing the way that we deliver the services for our tenants. And this is part of it. The other thing I want to remind everybody is that at the end of the day, this is an organization that has 5% turnover. And just this list, just this list is 2.5%. So not counting the other 1,300 that are overhoused and the almost 100,000 households that are on a waiting list. So once again, let's not forget that there's a lack of units. There has been years and years of lack of investment in the resources to properly service the tenants of the city. And to be honest with you, there has been a lack of staff training, staff motivation, staff involvement in directly delivering these services. So I think this report is a good start, and I'm happy to see that that's how TCHC is actually looking at it, that it's a good start, but that it's working on all these different components of a broader solution for this issue. So thank you.
Thank you. Councillor Wong-Tam.
Thank you very much, Madam Speaker, and I would like to also thank our Ombudsman and her incredible team of investigators. This is a very thorough report, and as much as it answers some questions, I can't help myself, but when I read it, I'm being drawn to more questions that perhaps are not, that don't have the answers here. But knowing that this report is coming back with a progress stamp date on it is of some encouragement. I want to welcome our new CEO, Kathy. Councillors, if you haven't had a chance to meet her, and hopefully you will soon, she's not just whip smart, as you can tell. She's hit the ground running pretty hard and fast. And our first few interactions, I have her working on a few things, and the response time has just been phenomenal. So I want to thank her for responding to my emails at the oddest times on the weekend, and she doesn't seem to sleep, and neither do I, so we could be dangerous to one another. But I want to just highlight a few things that haven't really been explored in the report, but I just want to put it out there for us to think about. When we talk about procedural unfairness and perhaps systemic biases, when we talk about system fails, and especially when we're dealing with vulnerable populations, I oftentimes wonder when we have systems that don't quite work, where the evaluation is not clear and it's not consistently applied, and then there is discretion on who gets in and who gets out, then I can't help but draw the conclusion of who gets left behind. And this, to me, is about an issue of equity as well. And although the report doesn't speak to that with that specific lens, I thought it would be something very important for me to at least bring up right now as we are tasking the TCHC staff to go off and implement these 21 recommendations. And I hope that they are able to sort of reflect upon what I'm saying, specifically around the vulnerabilities of individuals and the intersectionalities of those individuals who are vulnerable. So we know that the process is very cumbersome. Because there's a lot of forms, and I don't know on a good day whether or not I can even make sense of what doctors are telling me about my own health or the health of my aging parents. And if you can imagine that you are already not doing 100%. You may not be operating with full capacity, and now you have to manage all this very complex information, and you have to relay this to someone else who may not understand what you're trying to say to them, and there is nobody besides you who's making those advocacies on your behalf around your medical condition so that you can get yourself to a better place and to a healthier place. And so I really do struggle that when I think about our most vulnerable on the list and those who are feeling unsafe, those who are waiting for transfers, is exactly how are we creating accommodations so that those individuals who are trying to advocate for themselves are able to do so. So to me, that's an issue around equity and making sure that we provide those accommodations for people who do need them. And I think that I don't see that as a recommendation in the report. And if it's in there and I missed it, then my apologies. But I do think it's something for TCAC to think about and continue to think about, and to build it into their system so that when they do those evaluations, people are not going to be left behind. And it may be unintentional, but when you have site managers that can intervene to make arbitrary decisions, there will be human biases embedded into them. That's just the way it is. Those who can advocate very clearly, who can articulate themselves, who can speak English, who look a certain way, they are going to probably get to the front of the line. And there's a very good chance that they will get transferred first. So they may not be at the front of the list, but they could possibly get to the front of the line. So anyways, I wanted to just put that out there because as I read this report, that's the piece that I think perhaps is missing, and that's the equity component. As much as there is a task here to unpack what is broken within the system, and I know that the staff are here to fix that, but I think it would be an omission if I didn't rise and bring that up. Thank you very much.
Thank you. Councillor Aujameri to speak.
Thank you, Speaker. It's always very difficult for me when speaking to public housing and especially TCH issues because I have so many decades of knowledge about how this corporation just doesn't work and hasn't worked in the past, and as we see from the Ombudsman's report today, continues not to work for people, for those in need. We've seen today, and thank you for the Ombudsman's report, thank you very much, the lack of responsiveness of this organization. We've seen how the horrendous physical conditions have been matched by horrendous clerical errors that result in real-life tragedies for the residents. Of course, this woman's file was lost for 4 months. We should be asking ourselves, with all that we know about what goes on in this organization, why aren't files lost more often? And we've come to the point now in Canada's leading city where one of our leading oversight officers has actually said, let's throw in the towel and stop adding names to the list. Imagine
Imagine if anyone had told you this about any other city. You would be shocked. And yes, we're all just rolling along and not talking about the elephant in the room, and that is that there simply isn't enough public housing units to go around to service Canada's largest city, Canada's most important city. I wish that we could get our ombudsman to go to the other levels of government and write a report on what a fallacy it is that they are providing affordable housing. And what a fallacy it is that they have put real money into public housing. Because even our affordable housing initiatives don't add up to much, because they're simply not affordable. So we're living in a city that is unaffordable. We have all three levels of government not putting in any appreciable money into the lack of affordability to make families live in humanized existences. We have TCHC that continually and institutionally dehumanizes families who they are supposed to serve. And we finally get reports in the last 10 years that keep telling us the same things over and over, and yet the culture doesn't change. The culture doesn't change, and the government priorities don't change, even though we certainly have had an overabundance in the last 5 years of governments at all three levels making substantive announcements about how much money will be and how many millions of Canadian dollars will be put into the market for this housing. We have seniors living in conditions that we wouldn't want any of our dear ones to be living in. We have people in these buildings, in these edifices, who have real psychiatric problems that are not being dealt with. We are the largest provider of housing, largest landlord in Canada, and we can't get it together enough to offer the appropriate medical services to our people in need. Mental support services and physical support services. We have people living in conditions so bad that their housing ought to be deemed unlivable, uninhabitable, and yet they continue to live in this housing. I myself, when I was a lot younger, waited 9 years on a waiting list. 9 years to be housed. 9 years. And that's the average now. We can't go on like this. We can't go on letting other governments off the hook and ourselves off the hook, because we are just as complicit. How many ombudsman's report do we need before us to tell us that we're throwing in the towel? Let's not put anyone else on the list. If it weren't so serious, it would be a joking matter.
Councillor Kelly to speak.
All right, thank you, Speaker. Very briefly, I had the pleasure of serving on the board of TCHC on 2 occasions. The first one when we put together a lot of the policies that have directed it over the years. And I want to thank the Ombudsman for her report, because frankly, I learned a lot about that. And her report is going to be a required reading in my office, because we have a number of TCHC communities. And it's our desire not only to understand them, but to serve them as best we can. And I think that Ombudsman's report will be able to give us that help that we obviously need. So big thank you to the Ombudsman and to the new CEO of TCHC. All the very best. It's a very frustrating job to have, because frankly you're asked to do a lot of things without the money to do them all, or to do them as many of them as possible as well as you can. It is in certain respects a thankless task, but nonetheless a very important one. So Speaker, those are my observations and remarks.
So can we put the motion on the screen? Councillor Fletcher's motion. Recorded vote.
Councillor Kelly, please. Councillor Carroll.
We're coming, we're coming.
Councillor Kelly.
Oh, sorry, John.
Councillor Holland, please. Councillor Troy Z, please.
The motion carries unanimously, 35 in favor.
Okay, item is amended. All in favor? Carried. Our next item is on page 7, CC 36.13. Office of the Integrity Commissioner, and we're also going to be dealing with, on page 3, EX 30.17, review code of conduct for members of the local boards. Yeah, we're doing them one at a time, but we're going to do, questions could be asked. Okay. The Integrity Commissioner's annual report.
Good afternoon, Speaker, and good afternoon through you to all members of Council. It's my pleasure to provide the 2017 annual report of the Office of the Integrity Commissioner to City Council. I have prepared a few slides to provide you with some highlights of the work of the year, and I'll turn to that in a moment. Before I do that, I'd like to take this opportunity to acknowledge the hardworking staff in my office who assist me to fulfill the duties that I have, as well as to the many people within the clerk's office that support my office to carry out the functions that it does. And I also would like to acknowledge the support that other integrity commissioners and accountability officers across Ontario and Canada share with each other, including myself, to make sure that we're all developing a strong and consistent and coherent practice in the area of public sector ethics. The highlights that I would like to tell you about today are just to talk to you about what the priorities were in 2017. The second half of 2017 was dedicated quite significantly to carrying out tasks related to investigations. I have had an ongoing priority throughout all of the time I've been here to provide advice in a timely fashion, and I have some statistics to support progress toward that goal in a moment. I also spent quite a bit of time in 2017 providing direct outreach to the many local boards that serve this council. Another significant task that took place in 2017 was policy review regarding the new legislation, which will change the duties of the Integrity Commissioner in Toronto and will require all municipalities to have an Integrity Commissioner in Ontario. I also was engaged in a significant policy project, which is the matter that you're going to hear from me next on after the annual report's done, which is the review with respect to the code of conduct for members of local boards. As noted, I spent quite a bit of time this year meeting with local boards to make sure that they're familiar with the code of conduct that applies to them. And this has, I'm glad to say, significantly increased the requests for advice that my office receives from the local board sector. In 2015, which was my first full year, we received 15 requests for advice. In the past 2 years, we're receiving about 40 requests for advice. So that may not sound like a lot when we consider how many members there are, but that's a lot more than we were giving out in the past. The changes that are coming to the jurisdiction of the Integrity Commissioner are significant, and I met with most of you on an individual basis to make sure that you are familiar with those changes. In the interest of time, I'm not going to take you through the details of it, but I would be happy to answer any questions that you have with respect to those change in functions. Before leaving that topic, however, I would like to highlight that the changes that are coming have underlined what is now, I say, an acute need for the office to be more properly funded in accordance with the broad scope of responsibilities that it has. I'm also very privileged to be able to work quite closely with the other accountability officers in Toronto. And I'd like to remind Council that together with the Auditor General, the Lobbyist Registrar, and the Ombudsman, my office forms part of the most comprehensive accountability framework at the local level in Canada. And while our work must be carried out independently due to distinct mandates and statutory responsibilities, we all work hard to proactively cooperate and coordinate pursuant to the terms of a Memorandum of Understanding that we entered into in 2015. Some of the information contained in the annual report through you, Speaker, is highlighted on this slide. We provided quite a bit of advice this year, almost 200 requests for advice, including members of council and local boards. And I'm happy to say that we can provide this advice in a very timely fashion. So I provide advice to members of council in 2 days or less, 94% of the time, and to members of local boards in that time period, 87% of the time. We also are a great resource for members of city staff and for the staff that support the many boards in Toronto. So in 2017, we responded to more than 250 requests for advice or information from city staff and residents. In 2017, we received 28 new complaints. 24 of those were through the formal procedure. I issued 11 investigation reports, concluding 18 formal complaints. And I provided 30 education outreach sessions to all segments of the City of Toronto, and I've already highlighted for you that a significant part of that was to the local boards. Just to give you a sort of a snapshot of the time it takes to proceed with an investigation, I just started tracking this statistic in 2015, so time will tell how useful this statistic is long term. But and it's not a perfect statistic because it tracks whether or not a case received in the year is closed in the calendar year, and that's certainly my goal. It's not always possible, and that could be in part because it's received in the last month of the year. This statistic may be of more relevance or of interest. Since we've been tracking it, which we started doing in January of 2015, I can tell you that it takes an average of 271 calendar days for my office to conclude an investigation. In my opinion, this takes too long. There are a number of factors that contribute to this number, some of which are outside the control of my office, but some of them are within the control of my office, and I attribute it to the fact that we are a small office and we can't be working on all matters at all times. I also spent quite a bit of time with the resources of the office, engaged in some significant policy work. Some of this is flowing from the changes that are coming to the provincial legislation. I produced and issued a new interpretation bulletin for arena boards, which I know many of you will be familiar with. And the most significant policy project in recent months was the review of the Code of Conduct for local boards, which I will speak to you in more detail at the next item. My priorities for the year ahead are first and foremost to issue clear resources for all the members of council to be able to understand your duties as it relates to the Code of Conduct during the election period. So there was the city's policy on use of city resources was approved at this council meeting. Now that we have that confirmed, there will be resources coming, so stay tuned for that. I will also be placing a priority, as I did last year, on completing open investigations. And when prioritization is necessary, I will be prioritizing cases involving members of council. And then last but not least, I will be engaged in significant preparations necessary to prepare the office for the new jurisdiction, which will happen in March of 2019. From time to time, I'm asked how one can gauge the impact of the office that I oversee. Or from a more direct questioner, I'm asked, what is the point of your office? One way to answer these questions is to report on output, which is the main focus of the report you have before you. I trust that the information contained in the report illustrates that the office meets several needs. Its existence entrenches that public officials in Toronto are required to meet standards of conduct and not to use their office for personal gain. When advice is required, it is given. When allegations are made, they are investigated. When contraventions are identified, they are publicly reported. When answering questions about the purpose of my office, it's useful to take stock of the history of the office, now in place for almost 14 years. The codes of conduct and the output of this office has changed the culture at the City of Toronto. Members can seek advice to prevent breaches, and in Toronto, members do that. When contraventions occur, these are reported and attempts can be made through remedial actions or penalties to improve a member's future behavior. The system is robust, and simply stated, I have to say, the risk of a complaint and an investigation is real. I believe that the heightened risk of scrutiny in the form of an investigation and possible public report is a significant deterrent. But I know we cannot count the things that have not happened, and I would never suggest that the system precludes current or future failings. What I can tell you is that the Toronto Office of the Integrity Commissioner has for the past 14 years produced neutral reports of consequence for the benefit of the electorate and provided countless pieces of advice for those bound by the Code of Conduct. And starting in March of 2019, the model that Toronto City Council pioneered on its own initiative will be replicated in every city in Ontario. With that, I'd be happy to take any questions.
Thank you. Councillor Davis, questions?
Thank you very much, and as usual, thank you very much for your very good work throughout the year. I just wondered if you would remind us what the budget ask was for 2018. Thanks. You have 3 staff now, yes, and you're looking for 5?
Through you, Madam Speaker, I have highlighted the budget. I haven't brought the figures with me. I have 3 staff. Yes. I am seeking an external budget to have a stable amount of funding available to me for external investigation and legal support, and for a temporary resource that will enable me to improve and develop outreach to raise awareness of the new changes.
Right, so it was an amount of budget to be used for other outside,
yes,
to get opinions and various other things to support your work.
Yes, through you.
The new work in particular.
For the new work, yes, through you, Speaker. The reason why that's my recommendation is I do not believe I can recommend to Budget Committee or Council that we can support a permanent person in the office for that function. So I would like to have a flexible resource available so that we can measure and develop evidence about what is necessary in the long term.
Okay. And one of the things that is changing is the new jurisdiction, and you've pointed it out. and I'm not sure that councillors are that aware of what your new jurisdiction will be in the new year. You will now be actually investigating complaints under conflict of interest now, the Provincial Conflict of Interest Act, and making determinations. Could you just explain the new role?
Yes. Through you, Madam Speaker, the new legislation will bring into the jurisdiction of the Office of the Integrity Commissioner the responsibility to receive complaints about contraventions of the Municipal Conflict of Interest Act, which will be required to be investigated by my office. And I then would have the discretion to bring a matter to court to seek the remedies under that act if I thought that was necessary.
Are there other remedies?
So a lot of the details are, we will see how it gets resolved as the jurisdiction unfolds. I think how it will work in practice is that the Commissioner will review the allegations in accordance with the Conflict of Interest Act and the Code, and the Commissioner will decide whether or not the issues that were identified could be resolved by Council through its own procedures to adopt a finding and impose a remedial action, or if it's more appropriate that that matter go to court for a court determination. And as you know, through you, Madam Speaker, the court will have the ultimate authority to vacate a member's seat. That would remain within the jurisdiction of the court. So the more serious breaches, I predict, will be the ones that that a commissioner would go to court over.
Would go to court, but there is some possibility that you would, well, what it clearly is now going to require you to do is a lot more work.
Through you, Madam Speaker, yeah, it's hard to, I don't want to overestimate how much more work it will be. We do get a few calls a year about from people attempting to make Municipal Conflict of Interest Act complaints to my office. So but if we use that as a gauge, I don't predict many cases, but it may be that many people just know that we don't deal with it and they don't want to take on the costs of that. And so I predict there will be some more cases because it will be more accessible for people to make those complaints.
Exactly. And is it also not the case that the remedies are going to be broader, or there will be a greater range of things less onerous, and so in other words, people would not take forward conflict of interest, or were hesitant. The courts were hesitant to find someone in breach because the actual sanctions were very serious. Whereas if there is a suite of new remedies that are less serious, there may be a greater likelihood of more complaints and more outcomes and more work. If the remedies are broader, there's a broader menu.
Through you, Madam Speaker, I believe what the councillor is referring to is that the Municipal Conflict of Interest Act will be amended to provide the court with a broader range of penalties. As many of the councillors will know, through you, Madam Speaker, right now, if there's a contravention of the Municipal Conflict of Interest Act, the only penalty is to remove the person from office, and under the new legislation, the court will have a broader range of options, such as a reprimand or a suspension of pay.
Thank you. That was your last question. Councillor Matlow.
Thank you, Madam Chair, and thank you for the work you do. Do you believe, if you don't receive any resources that you're requesting through the 2018 budget, what do you candidly believe would be the consequences of that with respect to just the time frame of being able to deliver on investigations, or respond to complaints, or just do the work you do in general?
Through you, Madam Speaker, if the office doesn't receive the funding that it needs, then the cases will take an unreasonably and inappropriately long length of time to conclude. And that I think is a failing on the part of the office, and especially because we're a leader in this field, we should be doing a better job. And importantly, the provincial legislation will require cases to be completed within 180 days, and we are not able to meet that standard at present without the additional resources.
What is that So if it's not dealt with within 180 days, what is the consequence?
Through you, Madam Speaker, that's a good question. I believe a person who is subject to that complaint would likely have some quite strong procedural fairness challenges to the jurisdiction.
Essentially be stayed at that point?
Through you, Madam Speaker, there is no remedy in the Act for that failure, but I think it would be a matter of administrative law and a legal issue really for the applicant who would be subject to that. If they were unable to get their case resolved in a timely manner, it is a key principle of fairness.
So if the time frame would be impacted inappropriately or even to a dysfunctional level, do you have any concerns about the message that it might send to those? You just earlier said that part of the role we even have in the office in the first place was to send a message, a signal, proactive signal to behave yourself. Do you believe that if it is known that you don't have the resources to do that job effectively, would that undermine that message?
Through you, Madam Speaker, I guess how I would respond to that is I genuinely believe that in Toronto we benefit from a robust system where the risk of a complaint and an investigation is real, and I believe that acts as a deterrent because there are reports and there are consequences, and if we were unable to meet that, then that deterrent effect would be reduced.
Another question just on a slightly different line, but connected. Do you believe that, speaking of consequences, the tools that you have are as effective as they need to be? Do you need more teeth?
Through you, Madam Speaker, my view is that the role that my office can play is to provide neutral, fair, clear public reporting about contraventions, and that even a report that doesn't come with it a recommendation for remedial action or penalty is of consequence to people, elected officials and appointed officials, and that consequence is downplayed sometimes when we ask questions about whether there's enough penalties. So to answer your question more directly through you, Madam Speaker, I don't think we need more penalties or teeth at this time in terms of sort of penalties that could be recommended. I think we need to wait and see what the impact of the changes to the Municipal Conflict of Interest Act and the expanded jurisdiction, whether that results in more sort of hard consequences, which I know there are many people who believe there should be greater teeth.
Thank you.
Okay. Councillor Karygiannis, questions?
Thank you, Madam Speaker. Madam Integrity Commissioner, how long what's the length of time that you take right now to do a full investigation? How many days from start to finish?
So the average length of time through you, Madam Speaker, is 271 days. That's an average. We have concluded cases in a much shorter time period and in a much longer time period.
How many cases of all the complaints that you received have you concluded in less than 180 days?
Through you, Madam Speaker, I don't have that number at my fingertips.
Percentage, rough calculation.
Through you, Madam Speaker, since we've been tracking that since 2015, I would guess about on a handful of occasions we've been able to do so under 180 days.
So most of your deliberations are taking more than 180 days, more than 6 months.
Through you, Madam Speaker, yes.
So hence you're looking for extra money.
Through you, Madam Speaker, yes. That I have made that request through the budget process.
In a period that the whole city is looking for, last year the mayor asked all the departments to cut down by 2% and everything else. I would say, would I be correct in saying that you're the only one that comes looking for more money?
That's not what's before us here, please.
I've asked the question.
No, but that's not what...
I've asked the question. She said she wants more money.
I'm telling you that your question is out of order.
Fine. The Integrity Commissioner can take, if she wants to answer it, I'm not sure.
No, this is not before us. You have your annual report. If you want to speak about budgets, you come to the Executive Committee next week and speak.
Thank you, Madam Speaker. But when the Integrity Commissioner comes in a point of order and she says, I'm looking for extra money to hire more people, I think we have the right to question that. This was said here today. Well, you can rule what you want.
Thank you. To speak, Councillor Doucette.
Thank you very much, Madam Speaker. I'd like to start by thanking the Integrity Commissioner for her 2017 annual report. I know some of you wonder why every annual report I hold the item and I do ask for a presentation. These reports are important. Our accountability officers report to us, councillors. They don't come to a committee, they come to us. And we as councillors should be paying attention to the reports which are before us, whether it's actually an Ombudsman's report or whether it is an Integrity Commissioner report. All our accountability officers write these reports. I read these reports. Sometimes I think, oh gosh, there's a lot of detail in these. But you know what? I learn something every time. And from a lot of examples of questions councillors have asked of the Integrity Commissioner, can we do this or can we do that? Maybe by reading this report, we'd actually cut down the number of questions she gets asked by councillors. I don't know. I am also very happy to thank the Integrity Commissioner for coming out to all our boards and agencies. I know I keep bumping into her at all the different areas I'm in, and my BIAs and other associations, and I thank you for coming. And I know I'll be seeing you very soon at another BIA we have. Actually, we have the chair in this chamber right now. Sorry, I corrected. We've had the BIA there. Sorry, wrong one. Anyway, as I was saying, thank you for your report. I hope councillors do read these. It is very informative. We do learn a lot. We learn also about what our board volunteer members are asking questions. They now know they have someone to go to ask these questions. Before, as a councillor, I was on boards and we didn't know that you were able to go to an Integrity Commissioner to ask. So I will stop now, under 2 minutes. Thank you very much. We'll receive this report and we look forward to all the work you continue doing, and we will read the notices you sent to our office, because we need to know what's happening and how we have to run our offices and what we have to do as councillors, and what we shouldn't do as councillors. Thank you.
Thank you. Councillor Davis to speak.
Thank you, Speaker. While I risk you suggesting it's not in order, I am going to speak about resources for the Integrity Commissioner's Office. It's raised in the body of the report, and I think it's important to speak to this question. What we have before us is a very thorough summary of the activity of this office, and what is clear is that this office requires more resources. We have investigations that are taking on average 271 days. We also see a greater and greater spread between the number of complaints and the number that are resolved on the graph that was provided both in the report and in her presentation tonight. We also have learned this year that there will be broader and more complex jurisdiction being given to the Integrity Commissioner in 2019. For all of us around this chamber, we are going to be very surprised in 2019 to learn that our Integrity Commissioner now has the authority to both receive complaints, investigate complaints, and make recommendations about sanctions for complaints related to the Municipal Conflict of Interest Act. This is a whole new jurisdiction. She has set out very clearly what she needs to be able to take on that new jurisdiction for new resources. And I say to everyone in this room that when this budget comes next week, we must consider seriously this request. 271 complaints. More than that, sorry. Where's the number of complaints? But increasing complaints with 3 staff. 3 staff in this office. So I'll simply say again, I think we need to take that request seriously. We need to be in a position to allow the Integrity Commissioner to perform the new functions and be ready when they come in 2019. So I want to thank her again for all her work, and to all our accountability officers. We have been leaders, and I hope that as we take on these broader roles, that we will demonstrate, as we always have, the best practices here in the City of Toronto. Thank you.
Councillor Matlow to speak.
Well, I wanted to both concur with what my colleague just said about resources. It's clear to me that if this accountability officer and if any others are receiving more responsibility to undertake more work and a larger purview, then the means that they have should reflect the workload. It's just logical. It's not sort of, do we like them or don't like them or whatever. It's just they're doing important work for us. And I speak as somebody who I was just recently subject of an integrity commissioner complaint, and I am one now. And I still deeply value the work she does, no matter what she ends up reporting, because it provides a critical part of our democracy, which is accountability. And it asks us to be our best selves. And no matter who we are, no matter if we are our predecessors or successors or we're here today, we need those eyes and we need that pressure on us to continue to conduct ourselves as good as we can be. So I can just say on behalf of my constituents in Midtown Toronto and myself, thank you for the work you've done. Thank you for the report that you've provided, and thank you for the ongoing work you do. And I guess on the note that I said earlier, I'm personally responsible, perhaps, for some of your workload, and that I will express regret for.
Okay. On the item, all in favor? Carried. Recorded.
She has another one, right?
Councillor Davis, please. And Councillor Shiner, when you're seated.
Oh, that's right, we do. We do have time. We have the
Councillor Thompson, please.
The item is adopted unanimously, 37 in favor.
On page 3, EX 30.17, review of code of conduct for members of local boards. Councillor Davis, you just want to release it?
Speaker, I just wanted the Integrity Commissioner, if she could, to highlight some of the changes so that we're aware. Many of us are on boards of directors.
Councillor Matlow, please, we're in the middle of asking questions.
No, I think we timed them together so that the Integrity Commissioner could leave. But many of us are on BIA boards, and there are changes in the Code of Conduct. Some of them minor, many of them just cleaning up the language. But could you point out any of the changes that affect those of us who sit on BIA boards for that section?
Changes that I've proposed to the Code of Conduct, they will affect all boards across the city the same way, including BIA boards. And there's sort of 5 categories of them. So the first is just to clarify that in addition to being familiar with the legal frameworks that all board members and elected officials in Toronto must be compliant with regulations contained in the Criminal Code. I've also added reference to the Securities Act, which really was came to me because of the investment board, but there's no harm in it being included for the BIA boards or other boards. Right. The second is to clarify the language with respect to disclosing and using confidential information. This isn't a substantive change, but it's clearer for board members so that they know what their obligations are with respect to not only disclosing but using confidential information, and particularly not using it for their own personal gain. I have made recommendations to amend the Code of Conduct to restrict board members from providing services to the boards on which they sit. So directly providing services to the board will be prohibited. It was never advisable, but we didn't have a clear rule in the Code of Conduct, and now we will. I've also introduced a part of the Code of Conduct that will prompt members of boards to seek advice when they engage in outside activity, so outside of their board duties in another board, and that if that board happens to conflict with the work of the main board, they'd have to seek advice about whether they can stay on both boards. And then the other categories of changes are really truly in the category of housekeeping.
Okay. Councillor Davis,
may I ask questions now?
I thought you're asking the question.
She was making just a quick presentation.
Okay, so Councillor Davis, ask your question then.
What I wanted to understand as well, we now have Invest Toronto, and
we no longer have Invest.
Sorry,
Toronto.
No.
And then you create.
No. We have an investment board now. And we also have a real estate board, and I know there's a new name called Create TO, but you were asked specifically to add provisions that may address concerns for those members of boards that have access to confidential real estate transaction, investments, and so on. Could you just highlight any of those concerns and what you've put into the code to address them?
Through you, Madam Speaker, yes, the review was prompted because when City Council established the investment board, it thought it prudent to review the Code of Conduct to make sure it was sufficient for in considering the nature of the work of that board. And then City Council late last year made a similar recommendation with respect to what was then known as the Realty Agency Board. The main provisions I've recommended to address those boards' special duties are the ones relating to confidential information, to doing business with the board, and the amendments regarding the legal framework. In addition to that, I have written to each board to recommend that each board establish an appropriate policy to deal with, in the case of the investment board, whether there ought to be any personal trading in securities rules for the board members.
Right.
And in the case of the Realty Agency Board, not necessarily a personal trading policy, but a similar policy that would make sure that we were doing all we could to protect the use and disclosure of confidential information. So both of those boards have received that letter, and I've already met with the Realty Agency Board and understand that they have referred it to staff, and I'll be involved in the work coming from that to make sure we have, the right-sized policy to address those issues.
So policies such as that, an investment policy, or would those policies be policies that City Council would approve as well, or is that just something that remains within the purview of those boards?
Through you, Madam Speaker, those policies would be approved, and I think are appropriately approved by those boards as a matter of their own governance. But City Council would obviously have oversight over it, because it is a contravention of the Code of Conduct to fail to follow a policy of the board. So if there was a failure to meet that policy, then there'd be a remedy under the Code of Conduct.
Okay, thank you.
Okay, on the item? On favor? Carried. Okay, Members, before we go to the next item, do we have any quick releases so we know where we're at?
How many to go?
Is anybody interested in releasing an item? Councillor Holliday?
I do. I just, if somebody can help me with the number, it's the item on the amendment to the bar hours. It's members' motion, something high number.
We already did it.
No, it was held down.
I held it.
Yeah. You held it.
The Olympic one. I'm sorry, because you caught me off guard here. I don't have the number.
It's MM 3623.
MM 3623.
Yes, extending alcohol sales and services.
I have a quick technical amendment, if we could have it put on the screen.
Okay, that was moved by Councillor Layton and second by Councillor Grimes.
Yes, Holliday's motion, I think, is contrary to the intent of the motion.
So if I can tell you.
Okay, well, let's see what your motion is, because maybe it's not in order.
If I could have it on the screen, my quick technical amendment is that we amend the area to be King Street as an opportunity to provide relief to those businesses.
Oh, come on. It's all about helping each other.
I think it's great.
Why not?
Contrary to the intent of
It's a Howard Moscow motion. You're in good company.
I don't know if you've allowed me to place the motion, Madam Chair, but.
Okay, I don't think it's a quick item.
Okay.
And it's contrary to what the motion is, the intent of the motion.
So is your ruling that it's in order or not in order?
No, well, it's not in order.
It's not in order. Well, then I have no choice but to withdraw it and allow us to move on.
Oh.
Pretty funny.
Yeah. We appreciate.
On the item, all in favor? Carried.
I got my point.
That would have to be a separate motion, Councillor Holliday. Councillor Shan.
Thank you, Madam Speaker. I can release MM 36.5, declaring January 29th as the Day of Remembrance and Action on Islamophobia.
Who said hold?
I'll continue to hold.
All right. Councillor De Beermaker.
Thank you, Madam Speaker. I can release the MM 36.31, which was circulated a little earlier today. The motion which reads, resolution supporting the efforts of King Township, York Region, and Toronto and Region Conservation Authority to protect the headwaters of the East Humber River.
Okay. All in favor?
Supported by our chair of the TRCA, too.
Carried. Seconded by Councillor Nunziata, not by Francis. Councillor Wong Tam.
Much, Madam Speaker. On page 6, the item is...
Hold on. Let me get to the blue sheets. Page 6.
Yes, Madam Speaker. The item is CC 36.8, 203 Jarvis Street, zoning bylaw amendment application, request for direction. I'd like to move the motion that is now on the screen, and councillors, if you can just take note that it's attached to a purple document.
I believe that that's been circulated.
Yes, it's sitting on everyone's desk right now.
With a confidential report.
Yes.
Yeah.
Oh, sir, the address again is 203 Jarvis Street.
Okay.
Can I ask for a recorded vote, Madam Speaker?
Yes, recorded vote.
Councillor Perruzza, please. Councillor Perks. Councillor Mihevc, please.
Can you put this in the in camera?
Councillor Kelly.
In the confidential bin. Yeah.
Councillor De Bearmaker, please. Oh, we've closed the vote. If I could. Councillor De Bearmaker, we've closed the vote. Sir, can I have your vote verbally, please? Okay.
The amendment carries unanimously, 37 in favor.
Councillor Shiner? Oh, sorry. Item is amended. On favor? Carried. Councillor Shiner?
So, Madam Speaker, I had held item PG 25.4, prioritization of outstanding heritage conservation district studies, blah, 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 and there's a report on the item due from the...
I'm sorry, we can't hear you.
Is there a report here?
Councillor Shiner?
Well, am I okay with the report? Okay. Do I have to move a recommendation in? So, there is... I'm just making sure I know what I'm doing with my colleague who also wants to attach something to this. So my apologies, Madam Speaker. So I am prepared to move the recommendations in the supplementary report, and my colleague has an amendment to that, which I'm fine with. He just wanted to place, and then we can vote on the item.
Councillor Cressy?
Yeah, I have a quick amendment.
Okay, just
to
one
ensure
sec.
there's some interim monitoring measures.
Hold on, hold on. Hold on. Do we have it? We don't have it.
I've signed it. I've already given it back to them.
Okay, so we'll continue to hold it. Okay, Councillor Shiner, yes?
I also have a motion on PG 25.5, Bill 139, proposed transition regulation associated with the amendments to the province's land use planning appeal system. I do have a motion on that. And the motion is asking for a report from the acting chief planner and the city solicitor on anticipated resources that might be required to deal with development applications as a result of the appeals. That'll be a report that comes to committee. Council can consider whether we need or not to have resources behind it. I say that because at committee, we ask not how long the delay is, which is 5 to 7 years, but how many units have currently been appealed. And there is 130,000 residential units been appealed to the Ontario Municipal Board that aren't going to get built unless we find a way to settle the matters with the appellants. And this is simply to make sure that we'll be able to manage the process as it goes forward. And it's simply asking for a report on the staffing if there's any needs that we have to make that happen.
Okay, so the motion's on the screen. On favor? Carried. Oh, this is a quick release. If you have a questions, then it's not a quick release. Do you have questions? Okay. On the amendment, on favor? Carried. Item is amended. On favor? Carried. Thank you. Yes, I know you're there. I can hear you. And I can see you too.
But my microphone was off, so I had to speak a little louder. So I had held an item that was Councillor Davis's in regards to the funding for schools that may need it in one of the accounts. I am happy to release that.
Which item was that?
If I ask Councillor Davis, she'll tell me what I was holding. The member's motion.
Yes, it was 24.
36.24.
There was the confusion.
David, they just needed to prepare the motion to adopt.
36.24. Oh, member's motion. Okay. Okay, allocating land acquisition reserve funds. All right, so Councillor Shine, you're okay with it. So on the item, on favor, carried.
And Madam Speaker, the other one that I was going to release that got stopped because the motion wasn't ready, I'm signing something that I'm told is right, and I'm prepared to move so we can deal with PG 25.4.
I just mentioned to you that the motion is not ready, so we'll have...
I have now signed it because the part, in due respect, without two people jumping up, my colleague's motion was ready. The motion to adopt the staff recommendation wasn't ready. And now it is, and now I've signed it.
Hey, can you put it on the screen then? Okay, there it is on the screen. Okay. Okay, and there's Councillor Cressy's motion. Everyone okay with the two? Okay, so on Councillor Shiner's motion, on favor, carried. Councillor Cressy's motion, on favor, carried. Item is amended, on favor, carried. Recorded vote. You want a recorded vote?
Councillor Karygiannis, please. Councillor Carroll. Councillor Perruzza, please. Councillor McMahon. Councillor Wong Tam, please.
Councillor Fletcher, please. Councillor Palacio. Councillor Fletcher, please.
Councillor Lee, please.
The item as amended is adopted unanimously, 37 in favor.
Councillor Mihevc.
Yes, thank you. Madam Speaker, I do have an item. It would take all of, I think, 3 minutes to resolve if I could get a quick answer from staff on one issue that I think should be public.
So it's not a quick item?
Well, is 3 minutes quick? It is pretty quick to me.
Quick is like 10 seconds. Councillor Troisi.
Thank you, Madam Speaker. Page 6, quick release, CC 36.7. That City Council adopt the confidential instructions attached to this motion. It's been circulated.
Okay, so you're just moving that. So on page 6, CC 36.7, which is 301 317 Queen Street, OMB appeal. On favor, carried. Thank you. Councillor Fletcher. Item is amended. On favor, carried. Councillor Fletcher.
It's motion without notice, MM 36.30. Speaker, I'd like to move that ahead if I can.
Okay, that's the member's motion that was just circulated, MM 36.30.
Or a planning study.
Oh, Councillor Holliday says he has questions. Okay, it's not quick. Councillor Troisi, do you want to move your two members' motions? The one that's circulated, MM 3629, your Section 37 funds, and 482, 484 Front Street?
Yes.
Okay, so MM 36.29, Councillor Troisi is moving it. On favor, carried. MM 3632, on favor, carried. Thank you. Councillor Cole.
Thank you, Madam Speaker. I do have, there's a supplementary report I've been waiting on from staff that has been distributed now for North York item number, bear with me, 27-1. That sounds good.
Page 5.
On page 5.
Yes.
And so I guess I'm moving the supplementary report.
Okay. Councillor Coe is moving the supplementary report on page 5, NY 27.1. On favor, recorded vote. Oh, another one?
Councillor Palian, please.
Councillor Layton, please.
The motion carries 38 to 1.
Okay. So now we'll go back to the item we were discussing before lunch, which is on page 3. The EX 30.33, cost of preventing information being released at Toronto Hydro. So if we can put up the list on the screen. Councillor Perruzza, you are asking questions to Councillor Holyday on his motion. Councillor Perruzza, 3 minutes.
No, Speaker, I'm good. Thank you so much.
You're good? Okay. Councillor DiCiano, you were asking Councillor Holyday questions on his motion?
Yeah, thank you. Just for clarification, to Councillor Holyday, so this information stems from, I guess, a series of FOIs brought forward by the Toronto Star. Is that correct?
Yeah, according to the documentation as part of this particular council item, the letters in here refer to some FOI requests that were subsequently appealed to the Information and Privacy Commissioner.
Okay, so that was going to be my next question. These FOIs are in front of the Privacy Commissioner.
Yeah, it says here that the Toronto Star reported that it has filed freedom of information requests, and then the letter from the corporation talked about them being before the Information and Privacy Commissioner at present time.
Okay, so there's obviously a process here. Do you know if the ruling is imminent, or?
I would expect that a ruling would come anytime if it's with the Information and Privacy Commissioner. They'll make their ruling and they'll release that ruling.
Okay. Are you at all concerned that council is seizing control?
Councillor DiCiano, clarification of the motion, please.
Just one more question, Madam Speaker. I just want to know if the reason for your motion is due to any concern that council's trying to move around a process that's been established.
Well, yeah, what the purpose of my motion is to be more consistent with the shareholder direction that we have before us. There's another motion out here that essentially creates different shareholder direction. And my concern is that that different shareholder direction actually involves this council and in a roundabout way accesses that information that's currently before the IPC for adjudication. So we're kind of getting involved in an IPC request. I'm not sure that that's good governance. I think we should just stick with the process that we've got that's being laid out before us. And I think that the shareholder direction, helps council interface with its agency properly.
Yeah, okay, thank you. Those are my questions.
Thank you. So now we're going to be speaking on the referral. Names to the right. Request to question staff. You have 2 minutes. Councillor Perks.
Thank you, Speaker. I'm quite glad Councillor DiCiano asked those questions because it gets to the essence of why you shouldn't vote for Councillor Holyday's motion. If you believe that City of Toronto Council should not ask Toronto Hydro for this information for any reason, you have an obvious and clear path. You vote against my motion. So if you don't think City Council should have the information or should get involved in this process or any other reason, then you just vote against my motion. If you think we should have it, you vote for my motion, which raises the question, what do we achieve with Councillor Holyday's motion? Well, what Councillor Holyday's motion, what he just said in answer there is, we stay with the shareholder agreement. Do you know how the shareholder agreement is drafted? I know. I participated in amending it in 2007 to make it more, to give them direction to be more environmentally friendly. Do you know who approves it? We do. It's our shareholder direction. And if at any time we want to give different instructions to Toronto Hydro, that's our right. Ask yourself this: if the TTC or the police or the library wouldn't tell us how much money they had spent on something, would you accept that? If the answer is no, you vote for my motion. What happens if Councillor Holiday's motion passes? You don't get to vote on my motion. That's the first effect. But the second effect is we send a request to the Toronto Hydro Board. And according to the rules Councillor Holiday would like to use, they consider it, there's no timeline, and at some point maybe they tell us no. Then what happens, according to the process that Councillor Holiday would prefer, is we appoint a member of the public service. We come back to Council, debate this again, appoint a member of the public service to go view their records. No timeline, and no requirement that they report back to Council. Then, after a period of time, we come back to Council and try to compel them through an administrative inquiry to tell us what they saw.
Thank you, Councillor Perks. Thank you.
What's the point of that?
Councillor Carroll, 2 minutes on the referral.
Madam Speaker, on the one hand, I could support the referral if before lunch, when we ask the question, are you planning on reflecting the wishes of council when you were sitting there as a board member when this referral gets to them, and we didn't get an answer. We really didn't get an answer. We got a rather awkward look, if you don't mind my characterizing it. Madam Speaker, it's a simple motion. We're not actually saying we want that information they want. We want to know how much it's costing, or a member of this council wants to know how much it's costing to avoid giving that information. Toronto Star wants to know, they've filed asking for information from Hydro, that company we own, asking them to know some information related to the privatization consultants and to the hiring of 2 former members of Mayor Tory's campaign staff. What the council member wants to know, he's not the Toronto Star, he's a member of your body. And all he wants to know is how much money has been spent on legal fees to prevent the information from being released. He just wants that little piece of information. And we can refer that to Hydro so that in a roundabout way we're getting the information, or we can just say today we're giving that instruction now. That is the information we want on behalf of a member of council. I'll tell you this quickly, I only have 30 seconds left. I knew when I was on the Hydro Board that I wore 2 hats. I do have a responsibility to that secure corporation, but I also go there, unlike the corporate members of that board who always have the minority of board members who are councillors are to reflect us. So when we found out that Anthony Haynes was being paid more than you liked, when we found out that he didn't have a university degree after all, it was my job to go there and say, this body is not happy with that. They need a little more information about that education.
Your time's up. Thank you.
That's the job of the board member.
Thank you. Deputy Mayor Minnan-Wong, 2 minutes.
Be a great minister.
Deputy Mayor Minnan-Wong.
Yeah, thank you very much, Madam Speaker. So I'm going to support Councillor Holiday's motion, and I had a similar motion, but I was told that it was too similar. But what I wanted to capture in my motion, if you read through the material, there was a request that was made for this information. It was refused. So now there's an appeal process going on, and to the extent that I would like to see that appeal process continue, I think actually Councillor Holiday's motion is the correct one, that we should let that appeal process go through, and a decision should come and be made, and then in that time that it should go to the Hydro Board, and then we can consider it after that, and then therefore then after that we should see how it goes. I think that's the appropriate course of action, and I hope members support Councillor Holiday's motion.
Thank you. Councillor Shiner, 2 minutes.
So, Madam Chair, I'm asking, Councillor Cressy for a minute. I'm asking my colleagues not to support the motion from our colleague, Councillor Holiday, because it's only talking about what half of the shareholders' direction is. The shareholders' direction that's actually in place says you can ask the board to give it to you, and if they don't, then you can ask your staff under the same Article 9 to get it, and they're authorized to get it. That is the shareholders' direction. Not to just ask the board, but you ask the board, and if council and they don't give it to us, then direct our staff to do it, which I have an amendment to Councillor Perks' motion that will do that. If you support the referral, you're going to send it off to the board where we already know there's 2 members of the board that represent us that are going to say no, and you're not going to see the information. Now, what is the information?
Councillor Holyday?
I would like to just raise a point of personal privilege politely. I don't think it's fair for Councillor Shiner to predict how a board member, including myself, would handle this particular request. Nobody has said yes or no. Nobody sent anything to the board, and I think that's unfair.
Okay, thank you. Councillor Shiner, would you like to continue, please?
Before you stop my time, please.
I did stop your time. Now I put it back on.
I'm on a point of privilege right now, and I want to be able to respond to that.
Councillor Shiner?
So, to my colleague, Councillor Holyday, I apologize for surmising what you might have done when you couldn't give me a yes answer. I really figured it's most likely going to be a no, but I shouldn't say that, how you're going to vote in advance, so my apologies for that.
Okay, let's continue, please.
Well, decorum is important in here. So, it's the issue here of not, is there a challenge going on now which will be heard, which my colleague, Councillor Menon Wong, was speaking to. It's the issue of what the costs are. And that's the issue as to where a hydro utility is spending money. And we're entitled to know what that is. And I am so surprised that everybody's defending the answer of what the legal costs are. It's not the issue, it's nothing else. So, Madam Speaker, through you, I can't support sending it to the board where I strongly feel it's going to say, don't do anything. And if you want to not do anything, support Councillor Holyday. If you want to do something, don't support Councillor Holyday. I'll put the balance of the item down in front of us.
Thank you, Councillor Shiner.
I will put it down, and then we can vote on it.
Thank you. Okay, so we'll vote on the Councillor Holyday's motion. Recorded vote.
Councillor Perruzza, please.
The referral carries 20 to 18.
Speaker, on a point of order.
Point of order, Councillor Perks.
Thank you, Speaker. I'd like to make a procedural motion that in accordance with Section 2760 of Council Procedures, City Council remove item EX 21.17, headed Toronto Hydro's hired consulting firms from Executive Committee, and bring the item forward to City Council for consideration. So I'd like to speak to that as a procedural motion. That's my right. I just want to explain a little bit what this does. So as members will know, this is the second time I've filed an administrative inquiry about the activities at Toronto Hydro. The first one, which was co-sponsored by Councillor Davis, I filed a little bit over a year ago. It came to Council, and we referred it to the Executive Committee. At the Executive Committee, I went there to attempt to speak to it. However, a motion was moved to defer consideration of the item indefinitely. So that item currently sits with the Executive Committee. When an item is currently sitting with a committee and we want to debate it here, this is the process you use to debate it here. I just want to go through quickly what that administrative inquiry asked. It asked 10 questions. First, what is the scope of work and requested deliverables that Edelman Canada and Campaign Research have been contracted to provide to Toronto Hydro? Second, when was each firm retained by Toronto Hydro? 3, what information and material support is Toronto Hydro providing to each firm? 4, what was the amount agreed upon for compensation of their services? 5, which body or individuals decided that Toronto Hydro would retain consultants to deliver this work? 6, when was the decision to retain these consultants made? 7, what was the process undertaken to recruit these consultants? 8, was the Board of Directors of Toronto Hydro informed of the decision to seek contractors to provide these services? 9, was the Board of Directors of Toronto Hydro informed of the hiring of these specific firms? 10, did Toronto Hydro consult with any member of the Toronto Public Service or member of Council on either the decision to seek external expertise or in the choice of which consultant would be retained, and if so, who? After an initial delay of a month, while Toronto Hydro got their answer together, they responded. They responded partially to some of these questions. To some of them, they said that they do not share information on commercial contracts. During the questioning of, because this was referred indefinitely or deferred indefinitely, I was not able to ask legal staff from the City of Toronto if we had a right to this information. However, since the subsequent administrative inquiry went to the Executive Committee and then came here, I was able to ask on the public record the City Solicitor and staff from her office if there are any legal reasons that would prevent Toronto Hydro from giving us information. Their answer was very clear: no. We are the 100% owner of Toronto Hydro. If we want information from them, they must produce it. Eventually, through whatever, if this council all decides, or the majority of us decide they have to provide us with information, they must provide it. That's unlike an administrative inquiry, where they're not covered, and any answer they give is voluntary. So, I believe that it is vitally important that as the owners of a public company and the people elected to manage that public company along with the other services we deliver, the information and the questions that I just read out to you is something that everyone on this council should have the right to know. We're elected to manage this public company. We're elected to know how the public company that we own in stewardship for the citizens of Toronto and the electricity ratepayers in Toronto, to make sure that the will of this council and the people of Toronto is being met and that money is being spent out of those rates in a way that matches what this council and the voters who put us here have asked us to do. That's our duty. That's not something that it would be nice to have. That is a fundamental duty each person on this council has to the people that elected them. Any effort to prevent that information from coming to this council is a dereliction of duty and a willful choice to not do the job you were elected to do. Now, in discussing the previous item, the City Solicitor did say that it is potentially possible that some of the information in that item might have been confidential information, in which case the City Solicitor would review it and we would receive it on purple paper. That would be the same here. So I'm not asking to publicly expose anything that should not be publicly exposed. What I'm asking is that this council right now vote to put this item in front of council so that I can move a motion or someone else can move a motion asking Toronto Hydro to produce this information, which we as the elected government have an obligation to investigate. Thank you.
Thank you. Councillor, point of order, Councillor Campbell.
Point of order. Notwithstanding Councillor Perks's explanation of the item, is it in order for him to do that if we have already referred this particular item to the Hydro Board?
Yes, it is.
It is. Okay.
Councillor Holliday? Okay. Does the clerk want to explain it?
The item that Councillor Perks referred to is an entirely different item. It's not the same item.
Councillor Holliday, did you have a question? Okay. Yeah, we're ready to vote. I don't see anybody's name on the screen. Did you vote?
Councillor Shiner, please. Councillor Davis.
Councillor Ticiano, please.
The motion to seize from the Executive Committee does not carry. The vote is 20 to 18. The required two-thirds majority has not been achieved.
Thank you. Page 3, we'll go back to page 3, to top of the page. PW 25.10, Vision Zero Road Safety Plan. Councillor Fletcher. We're doing the Vision Zero Road Safety Plan. Do you have questions?
I do. I have a motion that I'm just getting ready there.
Do you have any questions to staff?
Sure, I'll ask a question of staff.
Any questions to staff, please put your name up on the screen. We're at Vision Zero Road Safety Plan, page 3, PW 2510. Okay, go ahead.
I'm just going to ask just publicly, and I will tell the clerk I just sent you a motion that I think you probably have that I'd like to make in a minute. But in establishing, in particular, I think that at committee there was a lot of emphasis on school zones, and that the chair, who unfortunately isn't here and is very passionate about Vision Zero, so that's too bad, had looked at this list of how many schools was it that was developed, Ms. Gray? Was it 100?
Through you, Madam Speaker, 100 in total.
100, and that was done in conjunction with the, I understand, Sick Kids Hospital, was it?
I'm sorry, I didn't hear the last part.
Was that done in collaboration with Sick Kids Hospital?
We actually did an analysis to establish those school zones in looking at a number of factors, largely related to safety, locations where we've had killed and serious injury accidents, and
where the Watch Your Speed signs were going?
The Watch Your Speed signs are a program. There's two elements to that program. One is a mobile Watch Your Speed sign program, which can be requested by anybody. So that could be from a school or a parent or a counselor or anybody who thinks that there's a speeding issue. Those are put up and they're moved around. So for a series of they're up for 3 weeks. And then there's a permanent Watch Your Speed sign program where we look in a little bit more detail, transportation does, about the quality of the speed and the volume of the traffic out in front of the school. And then those are installed permanently at those schools.
And I'm just wondering if we're able to get that table at some point, not now, I'm not going to ask you to produce that, but to be able to look at the table that advised you on those particular locations, and if you have traffic volume isn't part of that, as I understand.
We can certainly provide that. The other piece that we look at is the percentage of students that are living within a 1.6 meter radius of the schools, so demand. We are in the process of getting more comprehensive speed and volume data citywide. Once we have that, we will integrate that into our 2018 look at Vision Zero schools, and then we will reprioritize based on that information.
So would you look at the school, all the schools, then look at who lives in 1.6 kilometers, and then look at any accidents or anything of that nature. So that's how you prepared that list.
We look at the number of collisions that result in killed or serious injuries. We then look at the number of collisions occurring within a larger radius, so that same 1.6 meter radius of the school, and then we look at the volume of students.
So I guess if we wanted to see that, we could actually review all of that.
Absolutely.
And
yep.
Heavy nodding.
Yes.
To your
yes, indeed.
Left. The other thing is, I know at committee, I had talked about, besides all of the things that are going into what we're calling our school zone, or what more appropriately would be what Vision Zero articulates in the school zone and suggests for a school zone, that there's a whole number of things that we have in our own Toronto toolkit that have been in it for many years. For instance, at Withrow School, there are already bollards on the sidewalk so people can't drive up. All the schools have a pick-up and drop-off zone. Sometimes there's bump outs that are put in, but that's not considered part of our toolkit in any, it wasn't presented in any way, that those are things that we can choose from when we're looking at creating a safer school zone. So, can you comment on that, please?
That's correct. So we do have a series of tools that are part of the school zone safety program. We look at signals, we look at pedestrian crossovers, we look at signage and lighting, watch your speed signs, as I mentioned earlier, and then we look at all the other range of traffic control and engineering tools that we have at our disposal, depending on the site-specific conditions. So it could be bump outs, it could be bollards, as you describe, or speed humps, or some other things, depending on the location and the type of street.
So you'd have no objection to me adding those more formally into what committees might see as things you could have in, turn restrictions for certain hours, or right turn on red, and those kinds of things.
Correct, because we would make the decision to utilize those if we thought they were going to solve the problem. So they really are part of the toolkit, even though they're not currently listed as that.
And the community also needs to be able to think about those things as well.
Yes.
And they've got a long history of that. Thank you
Absolutely.
very much. And I'm moving all those things, so please support me.
Thank you. Councillor Davis, questions?
Thank you, Speaker. I wanted, just so that we can better explain this to our communities, is there a way that we can, or a place we can point our communities to say this is how this neighborhood is being assessed, or when it's going to be assessed in this multi-year plan? It's just, it's a very complicated set of activities, and it's not really clear to be able to find Parkview Hills, Topham Park. How do I find those neighborhoods and when they're going to be dealt with or assessed?
Yeah, to the chair, we've basically been working on the Vision Zero road safety website. That's going to be presenting a lot of that information on there. Currently, it's a case where we just have a basic map showing the various the locations that have been identified and selected for work, but we're going to be working on supplementing the information that's provided on that website, and in parallel with that, communicating out to the councillors to give you a bit of a heads up as the improvements are being selected within your ward and what things are being proposed and that sort of thing.
It's still hard to understand how the priorities were selected. So you started with 13 in terms of the school safety zones. There were going to be how many?
Yeah, so to the chair, for the pilot implementation, we identified 20 schools, and basically those schools were prioritized based on, as the general manager mentioned, the number of killed or seriously injured collisions that happened within a 1.6 kilometer of the school, the number of collisions that happened within 1.6 kilometers of the school, and the percentage of students who live within that. So basically the idea of in terms of walking distance from the school. But that selection criteria was specifically for just the pilot. We are looking to try and get additional data to supplement that in terms of speed data in and around the school, and we would be working on a new updated prioritization list that we can make available.
So we added, the report that's before us talks about acceleration.
Correct.
And you made a subsequent report through the Budget Committee to accelerate and to add more resources. Can you tell me what is actually going to be before committee next week, before executive?
Through the speaker, we've added, this will be the third acceleration of the program, and effectively we're looking at moving forward and accelerating, moving forward the proposals from through 2021 and accelerating those into 2018, 19, and 20, so doing an acceleration of the program. The total additional amount is $6.3 million over those 3 years that we would be accelerating the program, and the opportunities for that acceleration and expansion include increased pavement marking funding, additional school zones, so instead of doing 20 per year, now we'd be doing 40 per year, and additional road safety audits at high-risk locations, and I think that, what am I forgetting, Roger? Anything? Those are the principal ones?
Okay. Okay. One of the things I asked early on, and I'll just ask again, over the years, I have worked very effectively with city transportation staff, bringing together neighborhood traffic committees, creating committees, identifying some of the concerns, identifying potential solutions. The staff undertook additional study to confirm and draw conclusions and make recommendations for potential traffic measures. None of that work is going to be reduced in any way, is there, if we continue to work with our communities the way we have historically?
Absolutely not. I mean, we strongly encourage the continued engagement with the community on these issues. So that local look is very critical to ensuring that what we install is actually successful. And certainly your involvement, the councilor's involvement in that is quite critical. What Vision Zero does, as you know, is bases all of our areas of observation on data. And so we really do start with that citywide look at where we are seeing safety issues actually materialize. And so we start with that and then we tailor it to the local conditions.
It's just very hard to say to one neighborhood, you haven't quite met the priority list. And yet at the same time, from their perspective, there are some serious safety issues, particularly around schools. So there will continue to be access to additional studies.
Thank Councillor Davis. You're way over time. Thank you.
Thank you very much.
Thank you. Councillor Layton, questions?
Great, thank you very much. Just a couple of questions around the installation of new traffic signals and PXOs. In 2017, how many did we install?
Through you, Madam Speaker, we have that information and deep in our spreadsheets here. Give us 1 minute.
That's all right. I only have a couple of questions. So,
okay. Number of signals.
Put your time on hold, Councillor Layton.
Okay, thank you.
What's your speed signs?
22 signals.
We installed 22 signals in 2017, and PXOs was the other one you asked.
Yeah.
15 flashing beacons you didn't ask about, but 15 flashing beacons at school zones. And I'm going to have to get back to you on the PXOs. I don't have that number right in front of me.
Thank you very much.
But I'm happy to do that.
I'm going to be asking about a couple of these specific things. Would it be better if I just wrote them down and then maybe I can go after the next couple people and I'll only take 3 minutes in that time? Is that okay?
Yeah, okay.
Thank you.
Yeah, that's fine. Councillor Fragedakis.
Thanks, Madam Speaker. So I just threw you to the General Manager of Transportation. I was wondering, the Watch Your Speed signs, are they under the jurisdiction of Transportation Services?
Through you, yes, they are, both the mobile and the permanent.
Okay, because I actually was with your staff at a meeting with a school principal and parent council, and they were asking for one in my area, and we found out that it was broken. In Ward 29, and speaking with Councillor Burnside, I understand the Watch Your Speed sign in his ward is also broken. I'm just wondering what's happening. They're all broken. How can we get Watch Your Speed signs so that we can have these in school zones in the East End?
So we'll certainly look into getting those repaired if they haven't been fixed already. On the mobile signs, one of the things the acceleration does is actually add one more mobile sign to be moved around in each ward, so those will be new, but they certainly shouldn't be broken.
So when are the mobile signs coming to a neighborhood near you?
The additional mobile signs are in the 2018 budget, so once the budget is in place, we will procure those. I would assume they would be in place for the September school year. Does that sound right?
Oh, for the September, okay.
Well, we have to procure them. We have to do a vendor procurement for those signs.
Okay, then maybe you and I can chat offline about how to get the one broken in Ward 29 and in Ward 26 fixed.
Absolutely.
Thanks.
Thank you. Councillor Campbell?
Thank you, Madam Speaker. Through you to the General Manager of Transportation. Do we know what so it says 82% of pedestrian fatalities are seniors. Do we know what the causes are of these fatalities? Are we collecting data on why these fatalities are occurring?
Through you, Speaker, yes, we are, and many of them have been mid-block crossings on large blocks. So when you have a very, very long block and you have destinations on either side that are attractive to pedestrians, very often it takes quite a long time to walk. And so very often we see on the long blocks that people are stepping off mid-block.
I'm very interested in that answer because and I don't doubt that because that happened in my ward. And it was a young man in this instance that was killed by a car. But Transportation Services is reticent to put in either PXOs or pedestrian-activated lights because it doesn't meet the warrants.
So, Councillor, we are doing a study of the warrants and a refresh of the warrants this year. We are looking very closely at our practices for installing mid-block signals, especially related to locations where we know that we have issues with pedestrians and desire lines, because the penalty for doing a mid-block cross should not be a fatality. And so we really need to ensure that, especially on those long blocks, we're figuring out how to get those desire lines connected.
So there are certain areas where I think it makes perfect sense to have a PXO there. It's only a 2-lane road. There's a bus stop on the other side. And the response I've had from Transportation Services, and they're doing their job, is there's not 250 pedestrian crossings. There might only be 50 or 30. But for the cost of having a PXO, if it makes it a safer crossing, I think the city needs to show a little bit more flexibility.
Through you, Councillor, I would love to know where those locations are, and we can certainly take a look at them. We are, as I mentioned, redoing the warrants this year, and that's one that will be of particular interest to us so that we can try to solve some of these issues.
So there seems to be, and this is probably going to sound funny, but there seems to be an overarching focus on school zones. And yet, in school zones, I think people drive slower as a matter of practice. There are many other areas, because they know they're school zones, all right? But there are many other areas. When we have focused, the watch your speed signs are only going in school zones. And I mean, I would like to see this broadened beyond school zones, but are you prohibited from putting the watch your speed, by council direction, from putting the watch your speeds anywhere else but school zones?
Through you, no. In fact, the mobile watch your speed signs.
No, I meant the permanent ones.
So the permanent ones right now, they don't just go up in school zones. We do tend to prioritize school zones, and I would argue, or I would say that the focus is on vulnerable users largely. So seniors, we have senior safety zones. We launched a number of those this year. They also look to address the problems that are specific to that population. So longer crossing times at the lights, we time the lights for that. And also watch your speed signs go up in some of those locations. But we don't just limit them to school zones.
I thought there was council direction from over a year ago that it was only in school zones. Okay, so now, so you mentioned mid-block crossings. What else are causes of fatalities?
Distracted driving and distracted travel in general. Okay. Let's see. Speed is another huge one. So speed reduction is something, especially in the Vision Zero program, that we're always looking at, is how we can reduce speed.
So can you elaborate on that? Because if I'm crossing at a red light or I'm crossing at a green light, I've got the green, the speed shouldn't be an issue because I'm the pedestrian. So how does speed come into play in a fatality then?
Well, in a scenario where you have a free right turn, where people can make a right turn on red, very often they don't necessarily see the pedestrian in the crosswalk, and they accelerate through to make that turn. Same thing with left turns.
Do we have any statistics on how often, of all of the fatalities that take place, whether cyclists or pedestrians, are there any statistics kept as to how often drivers are charged?
I would have to connect with police, because police would keep those records, but I do believe they do have a write-up of all the specific situations at each of those locations.
Do you have a sense as to how often drivers are at fault versus pedestrians, inattentive pedestrians?
I couldn't give you a percentage, but distraction is often a key factor.
Councillor, that's your last question.
I was going to let you know that.
Okay, thank you. Councillor Ainsley.
Thank you, Madam Speaker. Ms. Gray? Thank you. Sorry, I don't want you to sit down again. I wanted to ask about the school safety zones. So currently the pilot project's for 20, and then I think I saw in the slide deck there's going to be 15 done a year, unless there's more funding available. And I was just wondering how long it was going to take for all of the identified schools to have school zones in the area.
So there's an acceleration of actually 40 per year from 20 per year, so a doubling of the program is what the acceleration calls for. I believe there. So we could be complete with that by mid-2020. So 100 school safety zones was our original program, and so we would accelerate that to be done by mid-2020. I believe there are 800 schools that are in the city.
Okay, so we're not going to be putting school safety zones in front of all the schools in Toronto.
Again, we'll be focused on those locations where we have speed, where we have crashes, serious injuries, high demand for children walking to the schools, etc. So some of the schools are perfectly fine to be using the toolkit that we currently have in place. The school safety zones are those where we really want to place that emphasis.
Okay. And how often will you be reviewing the parameters or the guidelines or requests for more school safety zones? Is that going to be done on an annual ongoing basis every year?
We'll be looking at the criteria annually, because we have to calibrate it according to the number of collisions, and ideally this year we'll be including speed and volume data on streets as well. So yeah, we will look at it annually and reprioritize that list.
Okay, and then the other one, I guess around the speed limits around all the schools, because one of the biggest complaints that I have in my ward is around the speed in general in the schools, and I often get requests that my residents would like to see it reduced to 30 kilometers, especially when the schools are in residential areas. Is there anything we're looking at for like a blanket reduction of speeds around schools in residential areas outside of the school zones?
So we have to get authority from the province to do default speeds in school zones. We are, though, working with the province and our regional partners on automated speed enforcement. That we believe has a very good chance of moving forward, and we would be able to implement that in 2019. And so there's still a lot of pieces of that need to come together, but that would certainly help with the enforcement of speeding in those locations. And we are also looking at individual locations where we can lower speeds. So the speed reduction in school zones has proven to be a very effective tool.
Okay, which leads to my next question about police enforcement and how we're engaging Toronto Police Services, because, for example, in 43 Division, which covers most of my ward, they have one dedicated officer that looks after speed enforcement and complaints about people not stopping at stop signs. They have other officers, I'm told, that they'll supplement that one officer, but they can be called away where the one officer is just dedicated to that. So I'm trying to understand what we're doing to engage Toronto Police Services in this program.
Through you, they've been a very strong partner in Vision Zero from the beginning, not only on the enforcement side of things with looking at the data and directing, because they do have a limited supply of officers, but directing those officers to the locations where we are seeing speed and crashes to be a challenge so that they can actually target their enforcement more effectively to the problem. They're very, very helpful at getting out to schools and providing information to students and to teachers about safety, both in school zones and anywhere they might walk in the city. And they've just been a very strong partner on Vision Zero overall.
And then my last question, Madam Speaker. I had a question about the senior safety zones. And there's one in my ward, I share it with Councillor with Hart in the Morningside, Lawrence area. And there are signs up that say senior safety zone. I'm just trying to figure out what's being done beyond that in terms of police enforcement. Are you reaching out? There's a lot of seniors in the area in buildings. So are your staff reaching out to seniors in the area? I'm trying to figure out what's being done more. I'm hoping that more is going to be done than just saying senior safety zone and hoping that people will slow down.
Yep, through you, the toolkit that we have deployed for senior safety zones in addition to the signs is longer crossing times for seniors, sort of refreshed pavement marking, signals where we need to have them. And then also we've identified those safety zones in locations where we know there are a relatively high percentage of seniors, whether it's a senior center or a housing area where we have a lot of seniors. And we've certainly been working with the senior committee that Councillor Matlow leads up on talking with them on kind of a regular basis about the types of improvements we want to see. Also, curb radius reductions is another thing to shorten those crossing distances, and no right turn on red. Excuse me?
Councillor Ainsley, you're way over time. You're 5.5 minutes. Thank you. I don't think we have time. It's 6 o'clock. Yeah. No, we have to break. Okay, we have 2 motions, Tad. Okay, can you put them on the screen? We have just 2 minutes. Okay, who is it? Who's got the motions? Councillor Fletcher, you have 2 motions that you'd like to introduce before we have our break.
I really do. Thank you. Councillor de Beremaker will move them and amend them to put the Scarborough Waterfront Trail on each of them. Am I right? There we go. That is for filming.
Okay.
Perfect location.
On favor? Carried.
That's right.
And the other one?
The other is the motion report coming from the staff. Oh, that's the same one. It's coming with a purple paper.
Okay, on favor? Carried. Okay, we'll recess to 6:30. Oh, one more. Okay, Councillor Shiner, you want to get to your seat so you can introduce your motion?
Which one am I introducing?
Well, the one that you signed.
So if we put it up on the screen,
Yeah, we will.
Oh.
There it is.
I haven't.
Okay?
Sure, yes.
On favor? Carried. Recess to 6:30.